All right, while waiting for the rest of the crew, let me see who's here. Hi, Alicia. Hello, Alyssa. Good evening, Angela, Baby Love, Belle, Ray, Edsel, Camille, Cheska, Clarence. Good evening, Kobe, David, Elaine, May, Erica, Eunice, Ferla, Laveril, Jelly Ann, Giovanni, Isabel, Jason, John, Camille, Katrina, Kimmy, Kina, Maria Tricia, Marielle, Mary Almeida, Masahiko, Melissa, Naika, Ray Ivan, Regina, RM, Romelyn, Rosalina, Ruby Ann, Rainuel, I hope I'm saying that right, Shania, Trisha, Yvonne, and Jumari. Good afternoon, magandang gabi, magandang umaga. Hello, hi uli. Hello. Okay, sige. Start na tayo. For those who don't know me, my name is Ansel Carriazo. I am the co-owner of Top Rank Academy International. I am a hospital administrator in one of the biggest health tech enabled company here in the UAE. And I manage a few healthcare healthcare facilities, not only here in the UAE, but in the US. We have facilities in the UK and other Middle East country. I'm a nurse by profession, but I'm a teacher at heart. Hence, we're here. Okay. Isa sa mga practice na gagawin natin for everyone, every time na mag-meet tayo, is that I want you to start our session by typing your name and the license na gusto mong makuha. So for example, Rosalina USRN, okay? Because I believe what you think of, what you write of, come into existence. So sanayin na yung mga system natin na naandyan siya. Okay? Katulad ng ginawa ni Laveril. Isulat niyo yung inyong pangalan and then your license. Mapahaad pa yan, UKRN, DUH, DHA, Prometric, kahit ano pa yan. Ilagay niyo siya. Okay? Sige, pasok-pasok lang mga USRN. Pasok-pasok lang po tayo. Sige. Yes. UKRN. Well done. Sige, pasok niyo lang siya. Kahit medyo parang dilulo siya, no? But USRN cute. Fairness to you, Erica. Gusto ko yarn. So, gawin niyo siyang masanayan ninyo yung idugtong, yung lisensya na nasa pangalan ninyo para kung anong nasa isip natin, gagawin natin siyang reality. Okay? Sige, pasok-pasok lang. Ang ating mga tinatawag na lisensya. Sige, puro halos USRN. Isa lang so far nakita ko pang UKRN. Meron bang haad dito? Yes, manifest work, pray, believe. Yes. That's so true. Meron ba ditong haad, Prometric, DHA? So far, puro USRN tayo. Sige. Lahat ng nag-type ng lisensya nila, dyan sa group chat, makukuha nyo yan. I know that. Okay. Sige. Start na tayo, no? So for the 3 days na magkasama tayo with OB nursing, we're gonna talk about ano yung mga common questions na lumalabas sa OB nursing. Now, ang atake pagdating sa international exam in terms of maternal, kahit sa ibang topic, right? Pare-pareho naman ng foundation, pati pare-pareho naman ng concept na tinatackle when it comes to the international exam at saka sa NLE. Ang pagkakaiba lang yung formatting ng question. So, kapag NCLEX, usually may mga specific question format sila. Kapag UK, CBT, kapag HAAD, pag DHA, pag Prometric, mostly multiple choice question siya. Pero kung tatanungin nyo ako, yung question format lang ang pagkakaiba, but the topic remains the same. Okay, so for the 3 days na magkasama tayo, we are going to talk about 3 things. In obstetric nursing, what are our responsibility or yung nursing process from the antepartum, intrapartum, and the postpartum period? Starting off with the antepartums. This is the time where we are caring for patients who are currently pregnant and or during their pre-pregnancy state. Okay, yun ang ating responsibility dyan when it comes to antepartum. So hindi tayo katulad ng NLE na magsisimula tayo sa anatomy and physiology, menstrual cycle. We are going to focus on the most common questions and most common topics na lumalabas sa mga international exams, starting off with the signs of pregnancy. Ano-ano ang mga signs of pregnancy? I-type natin sa group chat. Ano-ano mga signs ng pregnancy? PPP. Ano ang PPP? I-type natin yan sa group chat. Gising-gising tayo mga kabayan, mamaya na tayo matulog. Presumptive, yes, well done, Ruby Ann. What else? Presumptive, yes, probable, well done, Arlene. Ano pa? Positive, Rainuel. So, presumptive, probable, at saka positive. Now, another thing that you have to remember when it comes to presumptive, probable, and positive sign, kung lalabas ito sa mga international exams, usually select all that apply ito eh. Okay? So, you also have to associate subjective, objective, and confirmatory signs dito sa presumptive, probable, and positive na yan. Usually, presumptive signs are subjective findings or subjective reports made by the mother. Probable signs are usually objective assessment and objective findings noted by a doctor, or in some instances, hindi nila tatawagin doctor. They may call it a HCW or healthcare worker. Pwede rin daw pong HCP or healthcare provider. Okay? And lastly, positive are all confirmatory signs that point out to the presence of the baby sa loob ng tiyan ni mommy. So presumptive, probable, positive, subjective, objective, confirmatory, mother, baby, and mother, doctor, and baby. Okay? So, para mas madaling matandaan, kasi usually select all that apply ito pag lumalabas siya, ang mnemonics natin for presumptive sign is United Q. United Q, which stands for letter U, urinary frequency. One of the first signs na lumalabas during pregnancy is frequency in the urination that happens either in the first trimester of pregnancy or the third trimester of pregnancy. Kapag nangyari ang urinary frequency on the first trimester of pregnancy, this is due to the increasing levels of human chorionic gonadotropin. Human chorionic gonadotropin. Okay? Pagdutungtong naman ng third trimester of pregnancy, kapag nagkaroon ng frequency of urination, this is because of the pressure ng gravid uterus. Pressure ng gravid uterus on top of the woman's bladder. Kung ito yung bladder ng nanay, yung gravid uterus nasa ibabaw daw niya, because of that pressure, nagkakaroon ng frequency in urination. Okay? Next is letter N. N for nausea and vomiting. Nausea and vomiting, along with urinary frequency, increase in the level of human chorionic gonadotropin causes nausea and vomiting. Pero usually, first trimester of pregnancy lang ito nangyayari. First trimester of pregnancy lang ito nangyayari. Kaya pagdating ng second and third trimester, kapag nag-persist ang vomiting, that is already considered hyperemesis, gravidarum, hyperemesis, gravidarum. Okay? Sige, nausea and vomiting. Next is increased basal body temperature. Increased basal body temperature. This is due to the increased level of estrogen and progesterone in the body. Increased level of estrogen and progesterone in the body. Next is tenderness. Tenderness sa breast. Tenderness daw po sa breast. This is often one of the earliest signs ng pregnancy, frequently noted few weeks during the first trimester of pregnancy. Few weeks during the first trimester of pregnancy. Letter E stands for excessive fatigue. Letter E stands for excessive fatigue o yung tinatawag nating pseudo-anemia. Pseudo-anemia. Tanong, bakit daw may pseudo-anemia ang mga pasyente? Bakit daw po may pseudo-anemia ang mga pregnant patient? Bakit may pseudo-anemia? Anong isang physiologic change in pregnancy that is bringing about physiologic anemia? Anyone from the group chat? Anyone from the group chat? Is it increased in the plasma? Is it increased in the plasma or increased in the blood volume? Increased in the plasma or increased blood volume? So it is said that when you're pregnant, nag-i-increase ang blood volume sa iyong katawan. And that increase in the blood volume causes yung tinatawag nating hemodilution. hemodilution, kung saan na-dissolve or hindi naman na-dissolve, nasusobrahan yung amount ng plasma sa katawan, right? That it exceeds the number or the count of the blood cells or RBC in the body. Kaya parang nagkakaroon ka ng physiologic anemia. Okay? Next is letter D. D for delayed menstrual period. Delayed menstrual period or yung tinatawag nating amenorrhea. Amenorrhea, isa sa mga pinaka-common na complaint ng mga nanay kapag nagpa-prenatal care siya is hindi sila nire-regla. Tama? Sabi nga nila kapag Valentine's Day, di bali ng delayed ang sweldo, wag lang delayed ang regla. Di bali ng delayed ang sweldo, wag lang delayed ang regla. Kasi mauubos ang sweldo mo kapag na-delay ang regla. And lastly, yung tinatawag nating quickening. Quickening that is usually better late than pregnant. Yes, better late than pregnant. Di bali ng late, wag lang daw pong fraggers. Okay? Quickening, that is felt by the mother around usually 20 weeks of gestation is considered a presumptive sign. Kapag itong quickening na ito is observed by the healthcare worker, saka lang siya nagiging presumptive sign. Okay? Pero kapag siya ay nagiging probable sign. Pero kapag siya ay felt by the mother or reported by the mother, presumptive lang yun. Huwag kayo papalito doon, ha? Okay. Apart from the presumptive sign, punta naman tayo sa mga probable signs. So probable signs of pregnancy, sabi natin objective findings usually noted by the healthcare worker or the doctor. Punta tayo sa letter S. S stands for skin changes. Stand for skin changes. One is yung tinatawag nating cloasma or melasma. Ito yung tinatawag dating mask of pregnancy kung saan nagkakaroon ng discoloration usually sa face, sa kanilang neck, sa batok, sa kilikili, o kaya sa singit. Hindi totoo na kapag nangitim ang singit mo, nangitim ang leeg mo, kapag ikaw ay buntis lalaki ang anak mo. No, this is due to the increased level of melanocytes. Increased level of melanocytes in your body. Increased level of melanocytes in your body. Next is yung tinatawag nating linya nigra. Linya nigra. Usually nag-o-occur ito on the 3rd trimester of pregnancy and is typically observed sa tummy or sa abdomen ng nanay. Next is yung tinatawag nating striae. Striae gravidarum. Striae gravidarum. This is silvery white in color. Silvery white in color na usually nangyayari because of the stretching of the skin that happens during pregnancy. Striae gravidarum. Letter S, skin changes. Next, punta naman tayo sa uterine and cervical changes. Punta naman tayo sa uterine and cervical changes. Starting with our Goodell's sign. Anong ibig sabihin ng Goodell's sign? Goodell's sign. Anyone from the group chat? Anong ibig sabihin ng Goodell's signs? Goodell's signs. Goodell is tinatawag nating softening of the cervix. Softening of the cervix. Para gusto mong malaman gaano kalambot ang cervix na iyon, hawakan ang iyong earlobe. It is said that the cervix is as soft as your earlobe. Soft as an earlobe. Pag naging butter-like na yan, usually nanonote yan during labor and delivery. But during pregnancy, this is as soft as your earlobe. Softening of the cervix. Next, yung tinatawag nating Chadwick's. Ano si Chadwick's? Ito yung bluish, purplish discoloration. Bluish, purplish discoloration ng vagina. Kakulay daw ni Barney ang vagina mo. I love you, you love me. Let's go out and kill Barney with a bang-bang shot. With a shotgun, bang-bang. Barney's on the floor. Wala nang baklang dinosaur. Charot. Alam niyo na yung bagong Barney song, ha? I love you, you love me. Let's go out and kill Barney with a gunshot. Bang, bang, Barney's on the floor. Wala nang baklang dinosaur. Okay, Chadwick's, para matandaan. Chadwick's Barney. Next, yung tinatawag nating Hagar's or Hagar sign. Ano yung Hagar sign? Hagar sign, Hagar sign, Hagar sign, Hagar sign. Ayan. Hagar sign. What is Hagar sign? Softening of what? Softening of Wala na nag-type. Ay, mag-type kayo. Softening of the lower uterine segment. Softening of the lower uterine segment. Softening of the lower uterine segment. Well done. And lastly, yung tinatawag nating uterine enlargement. Uterine enlargement. Tanong, ma'am, bakit hindi confirmatory sign ang paglaki ng uterus? Is there any other medical condition that could contribute to uterine enlargement? Yes or no? Yes or no? Yes, ano yun? H-mole. Well done. H-mole, right? H-mole could also be associated with rapid uterine enlargement. Dahil may other condition that could cause rapid uterine enlargement, uterine enlargement is only considered a probable sign. It's actually one of the signs that is recently added by UWorld. Basta ang uterine enlargement, assessed ng healthcare worker. Ulitin ko ha, kaya ako in-specify kanina si mom, doctor, and baby, kasi kapag ang uterine enlargement ni-report ng nanay, hindi siya probable sign. Kasi ano nga ulit ang subjective findings often reported by the mother? Presumptive o probable? Presumptive o probable? Presumptive. Pero kapag assessed siya ng healthcare worker, saka siya nagiging probable. Okay tayo dyan? Okay tayo ha? Malinaw yan. Okay, next is yung letter P. Positive. Positive. Positive pregnancy test. Ma'am, bakit nag-positive na sa pregnancy test, hindi pa rin daw siya positive sign? May condition na naman daw po ba that could lead to positive pregnancy test? H-mole pa rin. Dahil merong existing na medical condition that would cause positive pregnancy test, hindi siya considered confirmatory, hindi siya considered positive sign, right? Positive pregnancy test is only a probable sign. Next, punta tayo sa letter B. Punta tayo sa letter B. Ano yung tawag sa painless irregular uterine contractions that is felt by the mother throughout the pregnancy? Anong tawag doon? Letter B? Braxton? Yes. Well done. Braxton Hicks contraction. Okay. Apart from that, meron pa tinatawag na ballotment. Tandaan nyo pa si ballotment? Ano si ballotment? Ano si ballotment? Hello? Bouncing. Okay. So kapag naglo-Lupol's maneuver ka usually, di ba? Pagka nag-initiate ka ng force on the other side, mararamdaman mo daw po na nagbabounce yung fetus sa loob. Tawag doon ay ballotment. Okay? Ballotment. Ballotment. Charot. And lastly, letter F. Letter F is fetal outline. Fetal outline palpation. Fetal outline palpation, especially during Lupol's maneuver. Fetal outline palpation, especially during Lupol's maneuver. And lastly, yung tinatawag na phonic souffle. Ano daw yung phonic souffle na yun? The sound that you hear during auscultation while you're performing Lupol's maneuver. Halimbawa, nilagay mo yung stethoscope sa tiyan ng nanay. Kapag narinig mo daw yung tunog na iyon, yung narinig mo during auscultation is called phonic souffle. This is produced by the rushing of blood into the umbilical blood vessels. Okay tayo dyan ha? Probable sign, SUP-BF. SUP-BF. Now, in the positive signs, tatlo lang yan. FMB. FMB. Fetal heartbeat. Fetal heartbeat heard using Doppler. Fetal heartbeat heard using Doppler. Movement felt by the examiner. Movement felt by the examiner. Kapag binago nila yung question na ito, pwedeng sabihin nila na visible movement noted or documented by the healthcare provider. It's also considered a positive sign. Pero kapag ang movement reported or felt by the mother, hindi siya positive sign. Siya ay presumptive sign. And lastly, visualization. Visualization ng fetal outline. Visualization ng fetal outline using different imaging techniques. Using different imaging techniques. FMB, positive sign of pregnancy. Okay tayo dyan ha? Now, base sa UWorld, ito yung pinaka-most updated list ng sign of pregnancy. I'll leave it all to you to go through it. Kapag lumabas itong signs ng pregnancy ito, usually SATA. So it is in your best interest na basahin siya at kabisaduhin siya. Okay? Ang kagandahan lang ngayon, kung NCLEX, may partial points na. Nung panahon ako ang nag-exam, walang partial points. Pag mali ka, mali ka. Ganun sila kalupet. Ngayon, at least, aasa po tayo sa partial points. Di bali ng kulang, wag lang sobra. Kasi pag nagsobra, ganun, magkakaroon ng right minus wrong. Pero kapag kulang, binibigyan ka ng partial points doon. Okay? Now that you've understand the different signs of pregnancy, now let's look at the physiologic changes of pregnancy. Para mas mabilis tandaan, ano ba yung mga physiologic signs of pregnancy na yon? Ang ating code or ang ating mnemonic ay changes. Changes starting with the cardiovascular system. Cardiovascular system, one of the major change na nangyayari sa katawan ng nanay kapag siya ay buntis is that the circulating blood volume, ang circulating blood volume daw ay nag-increase of approximately 40 to 50%. 40 to 50%. Kapag ka daw po nagkaroon ng increased blood volume, nagkakaroon ng tinatawag na hemodilution, kung saan nag-i-increase yung level ng plasma or nag-i-exceed ang level ng plasma in relation to or in comparison to the number of red blood cells in your body. Kaya nagkakaroon ng tinatawag nating physiologic or yung tinatawag nating pseudo-anemia. Okay, apart from the increasing blood volume, isa pa sa mga notable change in the cardiovascular system is that the heart daw po increases in size. Yung puso ng nanay lumalaki, nag-i-increase ang size. Apart from that, it is slightly elevated and towards, slightly elevated upward and to the left. Okay? Because of the displacement ng diaphragm as the uterus enlarges. Huwag mag-alala, these changes are minor at babalik po ito sa lahat sa normal as soon as ma-deliver ang baby. Ang pulse rate din ng nanay increases of about 10 to 15 beats per minute habang siya ay buntis. Blood pressure, ang blood pressure slightly decreases pagdating ng second trimester of pregnancy. Kaya kapag nag-increase ang blood pressure mo ng second trimester of pregnancy, this is related to pregnancy-induced hypertension. Because one of the physiologic change that happens in the body is that nagkakaroon ng slightly lang naman, pagbagsak ng blood pressure on the second trimester of pregnancy. Pero pag tungtong ng kanyang third trimester, aangat na ito but nothing above doon sa kanyang pre-pregnancy level. Nothing above the pre-pregnancy level. That's why it's in your best interest, nurses. Kailangan i-establish natin ang kanyang pre-pregnancy levels or pre-pregnancy findings para tayo mayroong point of comparison. Also, respiratory rate slightly increases during pregnancy, particularly in the late trimester. Second trimester of pregnancy, nag-i-increase yan. Okay? Because of the effort that they have to make kapag sila ay naglalakad. Okay? Next, apart from cardiovascular, there will be significant hormonal changes in the body. Halos lahat ng mga changes na nangyayari sa katawan ng buntis na nanay is influenced by the increasing levels of estrogen and progesterone which affects various body system. Katulad ng na-mention ko kanina, no, pinag-uusapan natin yung signs of pregnancy, it may be resulting to increased level of hormones, okay? So kapag meron pa mga changes, i-mention ko na lang kung ano yung hormone na responsible doon. Next is yung tinatawag nating altered respiratory system. Altered respiratory system. Anong nangyayari? It is said that oxygen consumption during pregnancy increases of about 15 to 20% kapag nagbubuntis ka. It is also said that the diaphragm is slightly elevated kapag nag-i-enlarge na or lumalaki na yung uterus. And that may result to shortness of breath. Para ba silang kinakapos lagi ng hininga dahil sa malaki nilang tiyan. Next, letter N is the changes in the nether region. Ano ba yung mga changes na nangyayari sa kanyang reproductive system? Isasama ko na dito yung mga changes sa breast. Although, technically speaking, hindi naman siya part ng nether region, kaya lang it actually just makes sense. Nakasama yung breast doon. Okay? Napag-usapan na natin yung changes sa uterus kanina. Sabi natin, there is bluish-purplish discoloration, there is uterine enlargement rather of the uterus. It's said that during pregnancy, the size of the uterus increases from approximately 60 to 1,000 grams as a result of hyperplasia. Kapag nagkakaroon ng hyperplasia, dahil daw po yan sa increasing levels of estrogen. Okay? Bukod doon, yung uterus mismo nag-i-increase ang size at saka yung number ng mga blood vessels na nag-i-increase sa uterus para daw po ma-accommodate yung growth ng baby sa loob. Contractions or yung tinatawag nating Braxton Hicks contraction typically is noticed as early as 16 weeks of pregnancy, pero pwede rin siyang as late as 23 weeks of pregnancy. Kapag nagkaroon ng quickening or movement ng bata, it is often noted by the mother at 20 weeks gestation. Part of nether region, cervix, sabi natin kanina, nagkakaroon daw po siya ng Goodell sign or softening of the cervix na pag-usapan na natin yan. Apart from that, this Goodell sign happens because of increased vascularization. Nangyayari daw po ito because of increased vascularization. At kapag nagkaroon ng increased vascularization, this is often caused by the increasing level of estrogen in the body. Yun ang dahilan kung bakit nagkakaroon ng softening na yan doon sa cervix. Bukod sa softening ng cervix, this increased vascularization also causes violet or bluish-purplish discoloration, which may happen around 6 weeks AOG. About 6 weeks AOG. Isa pang notable change during pregnancy sa ating cervix is yung tinatawag na secretion ng thick mucus plug. Secretion ng thick mucus plug na siya ay nagdi-dislodge or nare-release or na-expel, yes, operculum, kapag nagsimula na ang cervical dilatation or sumula na siyang mag-labor. Okay? Those are the changes in the cervix. Punta tayo sa ovaries. In the nether region, ang major function ni ovary is to secrete progesterone. Ang major function ni ovary in the pregnancy is that to secrete progesterone in the first 6 to 7 weeks of pregnancy. Kapag buntis ka, the maturation of follicles are actually blocked. And si ovum, hindi po siya nagkakaroon ng production because that happens when you are pregnant. Hindi na siya maglalabas ng ovum, hindi na rin magkakaroon ng maturation ng follicle. So technically, kapag buntis ka, nakaka-save ka ng bawas ng follicles. Okay? Next, vagina. Sabi natin ang ating vajayjay po ay nagkakaroon ng hypertrophy, which is of course expected in preparation of labor and delivery. Nagkakaroon din daw ng increased vaginal secretion. Nagkakaroon ng increased vaginal secretion. Usually it's thick, white, and acidic in nature. And lastly, sabi ko kanina, breast. Ano ba yung mga breast changes kapag ikaw ay buntis? Ang mga breast changes, nangyayari yan because of the increasing levels of estrogen and progesterone in your body kapag ikaw ay buntis. Ano pa? Bukod sa breast tenderness na pinag-usapan natin kanina, it also helps you increase in the breast size. So kung dating flat-chested ka, tama? Medyo may pag-asang lumaki. Ang dede mo pag ikaw ay buntis. Kaya lang, pag labas ng baby, maging flat ka uli. Minsan gusto ko din yan eh. Kaya lang hindi siya ano eh. Yung ibang mga dede pag ginanon mo, maganda yung labas eh. Ito wala, ayaw niya talagang galit sila, ayaw nila magdikit. Charot lang. Ano pa? Nipple. The nipple becomes more pronounced. Kung dati nang nakatayo ang utong mo, lalo pa silang magiging pronounced kapag ikaw ay buntis. Daig pa nila ang nakatayo for flag ceremony. Yung areola becomes darker in color. So wala na mamingmik na color kapag ikaw daw po ay buntis kasi nagiging darker siya. Ano pa? Nagkakaroon ng visibility ng superficial veins. Medyo nagiging prominent yan. Makikita mo yan dito sa paligid ng iyong breast. At syempre, colostrum may leak from your breast. Kaya nga, isa sa mga moral of the story, mga nanay, huwag niyo ipapadede sa mga tatay na mga anak niyo ang colostrum. Alam niyo kung bakit? Kasi doon nila nakukuha yung tibay ng loob at tibay ng katawan para lokohin ka. Moral of the story, huwag ipadede sa tatay. Ipadede mo sa kapitbahay para lumakas ang loob niyang mahalin ka in public. Huwag sa asawa mo, doon sa kapitbahay niyo. Yes. Para tumapang-tapang kang tawag ito, tumapang-tapang siya sa'yo. Yung mga asawa niyo naman, pag daddy niyo ng colostrum, titibay talaga ang katawan niyan. Papakilala ngayon sa inyo yung kabit niya. Doon nakuha ng ng asawa niyo yung tapang ipakilala yung kabit. Sakalin ko na ng asawa ko. Yes. So, ang moral of the story, wag ipadede sa kanila yung colostrum. Hayaan mo siyang masayang. Mate. Kapag tawa. Okay? Kuha nyo na, So, isa yan sa mga secret. Yes, once upon a time. Hugot ko yan siya. Okay. Kaya tutunan kayong bago, no? Punta naman tayo. Letter G. Yung tinatawag. Teka lang, Diyos. Asan na ba yung tubig? Tawa kayo. Dami kasi tala ko. Kaya pala maganda si Ma'am Jolly. Ibig mo sabihin, pisti ka. Wait lang. Teka lang ano yung sinabi niya? Hindi ko na-miss ko eh. Kaya pala maganda si Ma'am Jolly. Best advice, yes. The best advice, hindi papadede sa asawa niyo para hindi lumakas ang loob. Padede niyo dun sa kapitbahay para tumapang siya at paglabang ka. Aray ko, kaya pakadede mo kay kumpare. O, para aminin niya na anak niya. Hindi mo tubig. Ay ko na. Ginigising ko lang kayo. Kasi alam ko naman seryoso kayo magsulat-sulat eh. Ay. Sige. Hi, mama. Yung pusa ko dumadating na dito. Sabi ng pusa ko, Mami, huwag kang maingay. Diamond chika. Halika, dali, papakita kita, be. Papakita kita. Pakita niyo yung aking. Hello! Ako po si Nala. Hi! Ayaw niyo na. Tungit mo naman. Ayaw niyo. Okay, balik na tayo. Oh, cute yan. Alam mo ba, yung mga ganyang klase ng pusa, Scottish Fold yan siya. Napupulot lang yan doon sa nakukuha lang yan dito sa shelter. Sa Pilipinas ang mahal-mahal. Dito punta ka lang ng shelter, makakuha ka ng ganyan. British short hair, Scottish Fold, yeah. Kung pwede nga lang ako magdala ng dito ng mga puspin. Kaya lang kinukuha nila yung puspin eh. Ayun, dito sa Pinas. Grabe siya! Grabe ka sa siomay Siomay siopaw. Hi! Ano yung asawa ko? Hindi natin pwedeng pag-usapan yung yung kapitbahay. Andiyan na siya eh. Sarot lang. Kay Pepper yan. Hindi niya kinain. Okay, sige. Okay. Next is the gastrointestinal system. Gastrointestinal system. So, katulad ng ano sabi niya? Ano sabi niya? Inom ka po. Wait lang. Or tubig lang to Baka akalain niyo may vodka to, kaya soju. Hindi ka sure. Tingnan ka muna. Oh, hindi. Sanay na sanay ito. Hindi ito na-aspirate. Sanay yan lumunok. Oh, like, shut. Shut pa na. Charot lang. Naiinitan ako, katatawa. Yes. Ganun talaga. Pag matanda ka na, marami ka na experience. So, marami ako na-share. I had my glory days back in the day. Charot! O, tama na nga. Balik na tayo. Sige pa tayo. Ano sabi? Ref no? Wala na siya. Hindi na siya uso. Ano na siya? Numbed na yan siya. Dahil ko pa nag-magnesium sulfate. Oh, gusto siya? True. Okay, sige. Punta tayo sa gastrointestinal system. Napag-usapan natin kanina yung nausea and vomiting. As a result of the increased human chorionic gonadotrophin. So, yung nausea and vomiting na to typically subsides by the 3rd month because it's the exact same time kung kailan bumabagsak din yung level ng HCG sa katawan ng nanay, right? However, in cases of hyperemesis gravidarum, nagiging persistent yung iyong nausea and vomiting. Appetite is said to increase during pregnancy, and this is also in relation to the absence ng mga discomforts ng pregnancy. Kung halimbawang nakaka-experience yung nanay ng nausea and vomiting, of course, poor appetite yan on the first trimester of pregnancy. Kapag gumagaang-gaang na yung kanilang pakiramdam, saka na ngayon mag-i-increase ang kanilang appetite. And that would lead to increase in the food intake of about 15 to 20%, lalo na yung may mga taong nagsasabi pag buntis daw sila, they are eating for 2 people. Remember this, matakaw ka lang talaga. It's not about the quantity of food. It's not about the quantity of food, it's about the quality of food, okay? Hindi nagdadala. Same ako din. It's not about yung dami ng kinakain mo, it's about the quality of food. And when we talk about nutrition on our second session, we'll deep dive more on what is expected kapag buntis ka, okay? This is also the time kung kailan nagkakaroon ng alteration sa taste and smell. Ito yung mga instances na yun dating gustong-gusto niya yung amoy ng bawang na sinasangkot siya. Pag nabuntis siya, hindi na niya na-tolerate yung amoy na yon. And that's due to some of the gastrointestinal changes that happens during pregnancy. Now, speaking of appetite, posibleng magkaroon sila ng poor appetite at the 3rd trimester of pregnancy. Poor appetite pagdating ng 3rd trimester of pregnancy because of decreased gastric motility. Siyempre nga naman, kapag malaki ang tiyan mo, delayed ang emptying. Hindi rin ganoon ka-free yung movement ng gastrointestinal system mo. That would cause poor appetite. Along with that, you may also experience yung tinatawag nating constipation. Constipation may occur because of the increased level of progesterone in your body. Increased level of progesterone in your body or kahit yung pressure from the gravid uterus may lead to decreasing intestinal or gastrointestinal motility. Flatulence or utot ng utot at saka heartburn may also be noticed, again, because of decreased gastric motility and slowed emptying ng stomach, resulting from increased level of progesterone in your body. Hemorrhoids can happen because of increased venous pressure. Yung kanilang gums or yung gum tissues nila might be swollen and may easily bleed because of increasing level of estrogen. Estrogen ito usually. Or isa pang cause ng isa pang discomfort na usually or isa pang physiologic change na nangyayari because of increased oxygen, estrogen yung tinatawag nating thialism or excessive salivation. Excessive salivation. This is brought about by increased level of estrogen in the body. Increased level of estrogen in the body. Yes. So after gastrointestinal, let's move on to endocrine and renal changes. Punta muna tayo sa mga endocrine changes, okay? So mga endocrine changes, ang iyong basal metabolic rate, nag-i-increase yan. Ang iyong metabolic function, nag-i-increase din yan during pregnancy. Yung anterior lobe ng pituitary gland mo produces yung tinatawag nating prolactin that is responsible or that is needed during the lactation process. Yung posterior lobe naman ng iyong pituitary gland release yung tinatawag nating oxytocin, which is required for, or which stimulates rather, uterine contraction. Yung iyong thyroid activity slightly increases kapag pag nagbuntis ka. That's why if women have existing thyroid problems, that could be exacerbated kapag sila ay nabuntis. The body weight, of course, increases kapag ikaw ay nagbubuntis, and water retention is also increased. This is the reason why, or ito yung nagka-contribute to weight gain. Posibleng magkaroon ka din ng edema usually on the 3rd trimester of pregnancy. And lastly, yung pancreas mo, nag-i-increase ng insulin production. To be honest, tawag nito, ang problema mostly ng mga babaeng may gestational diabetes is not about the amount of insulin produced. It's about the resistance of the body with insulin. And we'll talk more about gestational diabetes kapag ka nag-disorders na tayo. Okay? Now, let's go to the renal system. Sabi natin kanina, isa sa mga signs of pregnancy is frequency in the urination. Usually, frequency of urination increases of about 25% in the 1st trimester of pregnancy. Along with that, nagkakaroon din daw po ng decreased bladder tone. Pero nag-i-increase ang kanyang bladder capacity. Parang ano siya, no? Parang ironic siya in the sense kasi nag-i-increase yung bladder capacity mo, pero yung bladder tone mo nagdi-decrease. Kaya ubo lang, tawa lang, lakad lang, minsan change lang ng position, parang naiihi ka na. And this decreased bladder tone along with the bladder capacity is brought about by increasing levels of estrogen and progesterone in your body. Okay? Next, punta tayo doon sa letter S. Tatlo yan. Skeletal, skin, at saka sensory. Skeletal, skin, at saka sensory. Okay? Let's start off with the skeletal system changes. Isa sa mga main changes na nangyayari sa katawan mo kapag ikaw ay buntis is nag-change yung center ng gravity mo. Nag-change yung center ng gravity mo. Anong usually nangyayari? Kapag ikaw, hindi ka buntis, ang center ng gravity mo is nasa center ng iyong katawan, right? Pero kapag nagbuntis ka, nag-i-increase yung size ng tiyan mo, that displaces the center of gravity in your body. Now, kapag nagkaroon ng change in the center of the gravity of your body dahil ikaw ay buntis, nagkakaroon din ng tinatawag na increase sa lumbosacral curve. Increase in the lumbosacral curve. This might be the reason kung bakit madalas ireklamo ng mga buntis na pasyente na masakit yung kanilang likod, or they may feel numbness and weakness, particularly sa kanilang likod. It may also contribute to walking difficulty, especially kapag nasa 2nd and 3rd trimester of pregnancy sila. And because of the change of, or because of the increase in the curvature ng lumbosacral area, this could also contribute dun sa tinatawag nating waddling gait. Okay? Si waddling gait, para silang, pag naglakad sila, imagine nyo, para silang pato. Okay? And that could also be contributed by, or be related to the relaxation at saka increased mobility ng mga pelvic joints that happens in preparation for pregnancy. Kaya para silang pato kapag sila ay naglalakad. Apart from that, yung kanilang abdominal wall, nag-i-stretch yan throughout the pregnancy, but of course, nare-regain naman yan to some degree or some sort pag ikaw ay nasa postpartum period na. Okay? Yung umbilicus mo, usually either nagfa-flatten or nagpo-protrude, depende sa kung anong klase ng pusod meron ka. Kung ang pusod mo is malalim na, magfa-flatten lang yan. Pero kung ang pusod mo nakalabas na, nagpo-protrude yan during pregnancy. Okay? So those are the skeletal changes. Punta naman tayo sa changes sa skin. Napag-usapan na natin siya a while ago. So some of the changes that happen in your body maybe because of the changing levels or increasing levels of melanocyte stimulating hormone as a response sa increased level ng estrogen and progesterone. Nag-i-increase ang pigmentation sa iyong katawan, kaya nga meron tayong melasma at saka cloasma, right? Meron din tayong striae gravidarum that is happening kapag ikaw ay nabubuntis. Yung hair growth mo, yung rate ng hair growth also increases kapag ikaw ay buntis. Now, one of the things that you have to take into consideration, though the skin changes are clinically insignificant, kasi parang out of all of the physiologic changes naman in pregnancy, hindi natin dapat masyadong parang it's easy for us to ignore those skin changes, right? But also take into consideration that pregnant women, particularly on the second trimester of pregnancy, tends to have a narcissistic tendency. Ano ibig sabihin nun? Masyado silang conscious sa nangyayari sa katawan nila, right? So though skin changes are clinically insignificant, napaka-importante na i-take into consideration mo pa rin yung tinatawag nating body image disturbance. Kasi hindi sila sanay yes, pangit na ba ako, mataba na ba ako, can it exacerbate po yung pain in clients with sciatica? Yes, especially kapag kapag naando na sila pag nag-engage na yung bata sa loob. Of course, it will all depend on the positioning ng bata sa loob, but yes, it can exacerbate kung may existing ka ng sciatica. Okay? Again, ulitin ko, those skin changes are clinically insignificant and may often go back to their pre-pregnant state kapag hindi na sila buntis, right? But you have to take it into consideration because body image disturbance is a big thing for pregnant women. Okay? Last letter S, yung tinatawag nating sensory. Kung eyes ang pag-uusapan natin, they may experience corneal edema. Kaya kung dati silang nagko-contact lens may become uncomfortable for them kapag sila ay nabuntis. Next is sa ears, nagkakaroon ng changes sa mucous membrane ng kanilang eustachian tube. Kaya may temporary hearing loss ang mga buntis na babae. Kakaroon sila nung tinatawag kung pag ni-report nila usually meron silang blocked ears. But of course, after pregnancy, kapag nag-stabilize na yung mga hormones sa kanilang katawan, it could actually go back. Kung tatanungin niyo ako kung anong hormone na nagko-cross nito, usually by increasing the levels of estrogen in the body. Okay? Any questions so far before we proceed to the teratogens? Any questions from the group so far? So far, so good? Thumbs up kapag okay tayo? Oy, thumbs up. Ano po yung nangyayari? Nagkakaroon ng changes sa mucous membrane ng eustachian tube causing blocked ears. Okay? Okay tayo ha? Sige. Next is teratogen. So now that you understand the different physiologic change and signs of pregnancy, let's move on to teratogens. Question. Papag-usapan natin ang teratogens. Sino ang priority mo during pregnancy? Si mommy? Si baby? Si daddy? O yung kapitbahay? Ayun naman tayo. Si mommy, daddy? Ay, yung kapitbahay? Sarili palagi. Kaya lang alam mo, kapag bahay ka, hindi mo pinaprioritize yung sarili mo. That's the truth. Si mommy, si baby, si daddy yung kapitbahay mo. Mga marida. Siguro ba? Yung driver, depende kung gwapo yung driver, why not? Pero kung mukhang homeless, no thanks. Sige. Sugar daddy. Alam mo, Eunice, mga na-realize ko sa buhay ko dahil ako yung magko-40 na, sana pala, I used my look. Kung ginamit ko lang, yes, mag-40 na ako. Mag-40 na ako next year. Kung ginamit ko lang yung looks ko, Dami ko sigurong pera. Para mama na lang tayo. True love pa kasi ako. Ay, true love gusto nga eh. Hayaan mo siya. Sanay naman na siya. May friend po ako. Gat bata daw. Sulitin. Para pagtanda. Tawa na lang yung siya. May maaalala. Okay. Yeah. So, sa mga bata dito, pag-isipan nyo. Pag-isipan nyo mabuti. Aray ko, Diyos ko, Lord. Joke lang. Pali ko naman yung asawa ko. Okay. Sige, balik tayo sa question ko. Sinong priority mo? Si mommy o si baby? So, kita ko yung sagot nyo kanina, iba-iba, no? May sumagot ng mommy, may sumagot ng baby. Ito lang yan. Ang nanay kasi, hindi ko sinasabing hindi sila priority ha. Kapag ka OB ang pinag-uusapan natin or maternity nursing, dalawa lagi ang pasyente mo. Yung nanay at saka yung baby sa loob. Kaya lang kasi, ang pagkakaiba ni mommy at saka ni baby, si mommy, nakahawakan mo, nakakausap mo, right? Nakikita mo siya. So may meron kayong physical connection. Nakikita mo kung may changes sa vital signs niya, nakikita mo kung may changes sa kanyang outward appearance kapag may nangyari. The problem with the baby inside or the fetus inside is that the only tangible assessment na meron ka most of the time is fetal heart rate. Okay? Kaya kapag pinag-usapan natin teratogens, ang priority natin dito is yung baby. Okay? Our priority is to protect the mother from being exposed to teratogens because hindi lang ito nagkakaroon ng problema sa kanila. Minsan nga kung magkaroon ng problema sa nanay, very, very minor lang siya, right? But our priority is to protect the mother from exposure to teratogen because it would either cause fetal harm or worse, pwedeng ikamatay ito ng baby sa loob. Okay, tanong. Anong trimester ng pregnancy kailangan nating protektahan ang nanay against teratogens? Kailangan mo silang protektahan throughout. Pero kung papipiliin ka first or third trimester of pregnancy, kailan daw sila dapat hindi na-expose? First or third trimester? Usually, first trimester of pregnancy or kung kailan nangyayari si organogenesis. Organogenesis or organ development happens during the first 8 weeks of pregnancy. So it is our responsibility to, as much as possible, do not expose the pregnant women to teratogens. Ano ba yung mga teratogens na iyon? Let's start with maternal infection. Let's start with maternal infection o yung ating famous na pneumonic torch. What does torch mean? Ano ibig sabihin ng letter T? T stands for? Anyone from the group? Toxoplasmosis. Well done. Ano ang letter? Putol-putol be ah. Toxo muna tapos. Okay lang. Okay lang, di. Okay lang, bestie. Okay, bakit putol ang bestie ko? Ano ang letter O? Ano ang letter O? Letter O is other infection. Other infection. Ano ang letter R? Ano ang letter R? Letter R? Letter R. Rubella? Ano ang letter C? Ano ang letter C? Patingin ako ng letter C. Cyto. Megalovirus. Well done. Ano ang letter H? Ano ang letter H? Ano ang letter H? Herpes simplex virus. Okay. Let's start with toxoplasmosis, okay? Pag sinabi nating toxoplasmosis, it's actually an infection caused by a parasite called Toxoplasma gondii, okay? It can be transmitted through various means. One, ingestion of undercooked or contaminated meat, water, and food. Okay, meat, water, or food. Pwede rin yung contact with cat litter or cat feces, right? Now, when a pregnant woman is exposed to toxoplasmosis, ang epekto niyan will be seen on both the mother and the baby. Problema nga lang, sa nanay, pwede silang asymptomatic, wala silang symptoms at all, or kung magkaroon man sila ng symptoms, it can be mistaken as flu. Parang mild lang kasi siya eh. Mild na flu-like symptoms lang siya. Okay? Now, many women who acquires toxoplasmosis during pregnancy may have mild symptoms that it makes it difficult for you to detect the infection without doing specific testing. Ang problema, sa nanay, asymptomatic lang siya or flu-like symptoms lang. Ang epekto nito sa teka lang ha. Yung mga anak ko yata sa lalamunan ko. Nagagalit, sandali. Buti na hindi nyo na-gets. Okay. Okay, sabi. May naka-gets. Stuck yung mga anak. Na-stuck sila sa loob. Problema dito. Sandali nga. Bisit ako ng tao eh. Natatawa ko sa tao mo. Huwag ka masyadong papadala sa tawa ko, mabubuang. Eko na nga. Katulad ng sabi ko kanina, sa nanay, pwedeng asymptomatic lang siya or mild flu-like symptoms. Ang problema nito sa baby, it could cause miscarriage, right? Pwede daw pong mamatay yung baby sa loob or magkaroon ng tinatawag nating spontaneous abortion. Okay? Sige. Pag lumabas ang questions ng toxoplasmosis examination, it would usually ask different things. One, ano daw ang reservoir ng toxoplasmosis? Ang reservoir would be cat, litter, or yung tae nila. Okay? Ano ang mode of transmission? Mode of transmission is what? Mode of transmission is direct contact. Yes, well done. Direct contact, ang mode of transmission. Now, question na lumabas sa exam. NCLEX yata itong question na ito eh. Meron ka daw pasyente. Sabi niya sa'yo may 4 siyang pusa. Okay lang daw ba na mag-pick up pa rin siya ng cat litter basta naka-glove siya? Yes or no? Handle daw ng cat litter basta naka-gloves or naghuhugas naman daw siya ng kamay. Can they do that? Yes or no? Yes or no? Yes or no? Actually, do not outweigh the risk. Lagi yung tatandaan yan, ha? So kapag meron kang pasyente nagsabing ganon, basta naghuhugas naman daw siya ng kamay at saka naka-gloves, no. Always be safe. Okay? Tandaan mo, ha? Right, that's right, Kobe. Sa NCLEX exam, ang ina-assess dyan is kung safe ka bang nurse. Right? Yun ang laging tinitignan dyan eh. Kung meron ka bang ngayon sa bago nilang NGN, meron silang tinatawag na clinical judgment model. Gano'n ka ba ka-familiar sa ano? Gano'n ka ba ka-familiar sa conditions na yun? Kaya nga nauso na yung part ng NGN, sinasama na nila yung documentation eh. Dati puro exhibit lang eh, nilalagyan ka lang ng ECG, ganyan. Ngayon, pati yung documentation during admission, specific timing nilalagay na nila dyan, pati yung mga test results, right? For them to determine whether or not you're familiar of the particular topic at hand. Okay? Kaya sanayin nyo na binabasa nyo pa lang yung situation sa question, alam nyo na agad, like in a glance, ano ba yung tinutukoy dito. Okay? So, tulad ng sabi ko kanina, kahit naka-gloves, kahit naghuhugas ng kamay, no. Hindi pa rin safe. Not safe, kahit na nag-hand wash yan, kahit na naka-gloves yan. Remember, do not outweigh the risk. Hindi safe sa kanilang mag-handle ng cat litter, kahit naghuhugas sila ng kamay or naka-gloves sila. Okay. Now, sabi natin kanina, toxoplasmosis could also be acquired from eating contaminated meat. Okay? Isa pang question na lumabas sa exam. Paano mo daw ma-ensure na hindi contaminated yung meat? Ano daw heat or temperature dapat mong iluto yung meat na yon? Ang tamang sagot is 100 degree centigrade. Okay? Para masigurado na hindi contaminated yung meat, dapat daw ang temperature is 100 degree Celsius. So, toxoplasmosis. Okay tayo dyan, ha? Next, let's go to other infection. Pag-usapan muna natin si HIV. Okay? Pag sinabi nating HIV, yung mga babae na previously infected ng HIV na wala namang signs and symptoms, they may first show signs and symptoms at the time of their pregnancy, and they may actually develop life-threatening infection dahil sinasabi na kapag ikaw daw ay buntis, you have some sort of immunosuppression. Tanong, bakit may specific level ng immunosuppression kapag buntis ka? Ano bang pinoprotektahan ng katawan mo kapag buntis ka? Bakit kailangan medyo bumagsak ng very, very light yung immune system? Yes, well done, Kobe. It's actually the baby. Remember, baby can be perceived by the body as an intruder, right? As a foreign body, right? Kung mataas ang ating immune response kapag tayo ay buntis, hindi maki-carry out ang pregnancy to term. Right? Pero, para masigurad, I'm just being amazed on how nagawa yung katawan ng mga babae, right? It is built in a way, right, to accommodate the growth of another life. And to be able to do that, nagkakaroon ng some sort of level of immunosuppression. Ano namang problema ng mga pasyenteng may HIV? Are they already considered immunosuppressed? Yes. Kapag isinama mo pa yung immunosuppression na dala ng pregnancy, this is the time where they will develop potentially life-threatening infections. Tandaan mo, ang pasyente mo kapag ka may HIV, hindi sila namamatay sa HIV. Ang kinamamatay nila is opportunistic infections. Okay? Isa pa, kung sakali na buntis yung babaeng may HIV, right? Repeated exposure to the virus during pregnancy, either through unsafe sex or yung continuous use ng or abuse rather ng IV drugs, this could increase the risk of transmission sa baby. Kaya part ng responsibilities natin kapag ang pasyente mo ay exhibiting risky behaviors during pregnancy. For example, sinabi niya sa'yo na meron silang, they're sexually active but they don't use protection. Okay, that's considered unsafe sex practice. Or they told you that they are drug users, particularly IV drug use. Okay, so ano kailangan mong tandaan? During the prenatal period, you have to initiate or institute measures of preventing or to prevent opportunistic infections. Habang nasa prenatal care, dapat daw i-institute na natin yung measures to prevent opportunistic infection. How do we do that? Avoid procedures that can increase the risk, yung tinatawag nating perinatal transmission. Paano natin malalaman yun or paano natin magagawa yun? Kailangan iwasan daw natin si amniocentesis. Kasi di ba sa amniocentesis, posibleng mapuncture yung umbilical cord. Pag napuncture yung umbilical cord, posibleng magkaroon ng blood mixing between the mother and the baby. Okay? That's your responsibility during the prenatal period. Now, what will be your responsibility during the intrapartum period? If ang fetus hindi na-expose sa HIV intrautero, ang pinaka-highest risk ng mga bata ay ng mga baby nag-e-exist kapag dineliver sila through the birth canal. Ulitin ko ha. Kung hindi sila na-expose sa HIV intrautero, the highest risk exists during the delivery of the baby through the birth canal. So how do we protect the baby just in case ilabas siya ng NSD? One, you have to avoid episiotomy. Why? To decrease the amount of the parent's blood in and around the birth canal kung sakaling lalabas sila doon. Ano pa? Avoid administration ng oxytocin. Why? Oxytocin increases the intensity ng contractions. Usually, mga contractions that is induced by the oxytocin causes yung tinatawag nating vaginal tears. Napupunit daw yung kanilang vagina. And because of that, you may necessitate or you may do episiotomy. Sabi nga natin, di ba? Kailangan natin i-minimize yung presence ng blood or body fluids in and around the birth canal kung sakaling lalabas ang baby doon. Next, you also have to minimize the exposure. Minimize the exposure ng baby or ng neonate sa nanay, sa blood at saka body fluid ng kanyang nanay. How do you do that? We remove the baby as soon as possible after the delivery. Hindi dito applicable yung first latch. Hindi dito applicable dito yung skin to skin muna para ma-promote ang mother-fetal bonding. No. You have to minimize exposure ng baby doon sa blood ng nanay. Ano pa? You also have to make sure that you suction fluids from the neonate promptly as soon as na-deliver sila. And you have to prepare to administer yung tinatawag nating sidovudin sa kanilang nanay during labor and delivery. That's your responsibility during the intrapartum period. Now, what do you do in the postpartum period? What do you do during the postpartum period? One, you watch out for signs of infection. You may also be required to put the mother on protective isolation kapag sila ay immunosuppressed. Now, question, is breastfeeding allowed sa mga pasyenteng may HIV? Yes or no? Breastfeeding, yes or no? So, ang tamang sagot dyan ay depende. Okay? So, ang pinaka-safe nating gawin, ang pinaka-safe nating gawin is to follow the healthcare provider's recommendation about breastfeeding. Kasi iba-iba ang sinasabi ng mga references eh. It is said that on developed countries or on first world countries where presence of alternative formula or milk formula is available, pwede natin i-restrict si breastfeeding or si chest feeding, right? But in countries, yung mga developing countries, right, where wala naman silang means para mag-provide ng mag-provide ng alternative or ng milk formula, pwede nilang i-allow yung breastfeeding. Okay? So it depends. Ang pinaka-safe dyan, follow the healthcare provider's recommendation about breastfeeding. Question, can the baby room in? Yes or no? Can the baby room in with the mother? Yes or no? Type tayo dyan. Can the baby room in? Yes, correct. Pwede naman silang i-room in. Wala namang problema doon. However, you always have to take into consideration, depende sa agency procedures. Marami kasing facility sa US, depende state to state, kung anong policies nila. May mga policies na dapat yung bata nasa NICU first 24 hours ng kanilang life para daw ma-complete yung tinatawag na mga baseline na lab study sa kanila or kung dapat silang maka-receive ng initial treatment. Okay? Yun ang usually ginagawa dyan. But if you ask me, pwede ba silang mag-room in? Pwede naman. Okay? But it depends on the policies or the facilities policy when it comes to rooming in or when it comes to monitoring ng baby in the first 24 hours ng kanilang life. Okay. Next, punta tayo sa tinatawag na syphilis. Okay? Syphilis, is a chronic infectious disease caused by an organism called Treponema pallidum. Okay? So, ang transmission usually nito is through physical contact with the syphilitic lesions. Kailangan may contact ka sa mga lesions na ito, which are usually found sa skin, sa mucous membrane ng mouth, or minsan sa genitals. Okay? Now, the problem with treponema is that the organism may actually cross placental barriers and can be passed to the fetus, particularly kung nangyari yan around 4 months of pregnancy. Posible silang magkaroon ng tinatawag nating congenital syphilis. Okay? Ano ba usually ang nagiging problema kapag nag-cross sila ng placental barriers? Infection usually leads to spontaneous abortion. Pwede silang magkaroon ng miscarriage before the age of viability, right? Kung sakali naman na hindi sila na-abort at na-continue ang pregnancy hanggang term, it increases the incidence of yung tinatawag nilang mental subnormality. Ibig sabihin, itong mga batang ito may have learning disabilities. They may also have physical deformities to some extent. Okay? Now, kapag nag-positive ang nanay, yes, retardation or mental disability. Pag nag-positive ang nanay sa syphilis, treatment with antibiotic is necessary at kailangan i-instruct mo sila na hindi lang yung nanay or hindi lang yung buntis ang magti-treatment, pati yung kanilang partner, kailangan matreat na rin. Okay? Dito usually nakakabukuhan eh. Kasi may syphilis kasi kumare meron din. Nahawa pa. Na-contact tracing totoo. So, apart from that, hindi lang daw po kailangan mag-receive ng treatment ng kanilang partner. They may also be instructed to avoid sexual intercourse until treatment is instituted. Okay? It is also said na kapag ang isang tao nag-positive for syphilis, they're also required to be tested for HIV. Tandaan nyo yan, ha? Ang mga nagpa-positive sa syphilis, pag nag-positive sila dyan, kailangan matest na rin sila for HIV. Okay? Sige. Punta tayo sa hepatitis. Punta tayo sa hepatitis. Brain ko lang to. Pwede na siguro dito. Punta tayo sa hepatitis B. Okay? Pag sinabi nating hepatitis B, natatransmit yan to blood, saliva, vaginal secretion, pwede rin sa semen, pwede rin sa breast milk. Okay? And it can actually cross placental barriers. Ano ating priority? Kapag ang nanay mo ay, ang nanay daw po ay may hepatitis B, if they have hepatitis B, we have to minimize the risk of yung tinatawag nating intrapartum ascending infection. Intrapartum ascending infection. How do you do that? You have to limit the number of vaginal examination na ginagawa mo during the intrapartum period. Okay? Sa postpartum naman, ang responsibility mo kung may hepatitis ang nanay is to remove the blood from the neonate as soon as possible or immediately after birth. Paano mo ma-remove yung blood na yon? Kailangan isaction mo agad yung bata. Tapos, kailangan paliliguan mo sila bago ka magbigay ng kahit anong klase ng injection, bago ka magbigay ng kahit anong klase ng eye prophylaxis. Pag ito tinanong sa examination, what would you do first? Bathe the baby or give Hepa B vaccine? Anong sagot mo? Bathe or give Hepa vaccine? Bathe or shot? Bathe or shot? Ligo muna, right? Hindi pwedeng tutusukan mo siya ng may dugo pa sa katawan that could actually cause transmission. Another question. Bago ka daw magbigay ng eye prophylaxis, ano daw ang gagawin mo? clean the face or ilagay lang diretso yung eye prophylaxis? Clean the face or eye prophylaxis? Clean the face muna. Okay, mako-cover mo na yan kapag ang pasyente mo niliguan mo na. Clean and dry. Yes, that's correct. Okay, now, ang infection sa neonate can actually, yes, linisan mo na, liguan mo muna yung bata. Dapat wala muna siyang dugo sa katawan niya bago mo gawin ng kahit anong klase ng administration ng gamot. Okay? Now, ang infection sa neonate can actually be addressed by tinatawag nating vernix. Hindi ba kasi may vernix? Paano yun kakapit yung dugo sa vernix? Kaya nga kailangan ano siya linisan siya. So hindi natin make use yung vernix gaseosa for insulation. Ang priority natin dito is yung protection nila from transmission. Yes, tatanggalin na din yan siya. Okay? So, katulad ng sabi ko kanina, infection of the neonate can be prevented by administration of yung tinatawag nating Hepa B immunoglobulin at saka yung hepatitis B vaccine. Okay? Binibigay ito as soon as na-deliver siya, basta siya ay nakaligo na. Tapos pababalikin sila ng first month, tapos 6 months. Yan ang usually binibigay sa kanila. Sinasabihan din yung mga magulang, particularly yung parent or yung nanay na may Hepa B, discourage them from kissing the baby hanggat hindi nakokompleto ang vaccines. Hanggat hindi pa siya nakaka-receive ng vaccines, hindi pa daw siya dapat halikan. Okay? You also have to inform them that pwede namang, actually pag hepatitis B, katulad lang din yan ng HIV, right? You follow the recommendation of the physician. Kung may mga facilities na kapag fully vaccinated na yung bata, pwede nang i-resume yung breastfeeding. May ibang mga facilities naman, minsan nga, same facility, iba't ibang doktor, iba-ibang trip nila. Okay? So the safest is follow the recommendation of the doctor when it comes to breastfeeding with Hepa B. Pero may mga facilities na kapag fully vaccinated na ang baby, pwede nang i-supportahan ang breastfeeding. But there are other facilities that will not do so. Okay? Sige. Punta tayo sa tinatawag nating rubella. Punta tayo sa tinatawag nating rubella. Rubella o yung tinatawag nating German measles. Usually, nako-confuse yung mga tao dito sa German measles at saka sa rubiola. Tandaan mo, rubella, 2 letter L, 2 word, German measles. Si rubiola, isa lang ang letter L, isang word lang yan, measles yun. Magkaiba yan sila. Okay? So, German measles is a viral infection caused by the rubella virus. Kapag nag-come in contact ang mga pregnant women with rubella, right? It would have effect for both the mother and the baby. Ano ang mode of transmission kapag ka rubella? Ano ang mode of transmission? Droplet, yes. Droplet ito. Now, ano ang mga signs and symptoms? Usually, signs and symptoms dito sa nanay, maybe mild lang siya. Meron silang rash, meron silang low-grade fever, yung iba, swollen ang kanilang lymph node, yung iba pa, pwede silang mag-complain ng joint pain. Okay? So sometimes, rubella infection may be unnoticed, or they may be mistaken for common cold. Kapag nangyari ito sa bata, on the first trimester of pregnancy, it could be considered teratogenic. Question na lumabas sa exam. Kung ikaw ay charge nurse na nag-a-assign ng mga pasyente bago mag-start ang shift, pwede mo bang i-assign ng unlicensed assistive personnel sa isang pasyenteng may fever and rash? Yes or no? Sagot tayo sa chat. Yes or no? Pwede mo bang i-assess or i-assign ang pregnant na UAP sa may fever and rash? No. Tandaan mo ha, even if the rash starts to disappear, ang period ng communicability is long. Rubella, chickenpox, communicable pa rin yan sila before and after the appearance of the rash. Kaya dapat hindi mo sila i-assign doon. Okay? Ano ba ang danger? The organism can be transmitted across the placenta. Posible silang magkaroon ng congenital defects sa eyes, sa heart, sa ears, minsan pati sa brain. Okay? So that is rubella. Now, let's go to cytomegalovirus. Ano ang nangyayari sa cytomegalovirus? So in CMV, the transmission is usually through close personal contact, right? Kapag na-transmit ito, it can actually cross the placenta or pwedeng yung fetus ma-infect siya through the mother's birth canal. Yung mga nanay, they can be asymptomatic. Yung mga baby din, they could be asymptomatic at birth. Ang problema lang sa cytomegalovirus is that it causes low birth weight. It could also cause yung tinatawag na IUGR or intrauterine growth restriction. Posible rin silang mayroong enlarged liver at saka spleen. Okay? They may also have jaundice. They may have blindness. They may also have hearing loss. At saka pwede rin silang magkaroon ng seizure. Okay? Antiviral medication may be prescribed to women with severe infection, which is severely infected by cytomegalovirus. However, itong mga antiviral medication na ito are often toxic. At saka, yung kanilang ang magagawa lang ng antiviral medication na yun is to temporarily suppress yung shedding ng virus. So, yung risk at saka yung benefit noon, kino-consider yan ng mga healthcare provider. Isang tanong na lumabas sa exam, anong klase ng precaution ang kailangan mong i-maintain kapag may cytomegalovirus? Anong precaution ang kailangan i-maintain kapag may cytomegalovirus? CMB, anong contact precaution? Contact precaution. Grabe siya, pagka daw kaaway yung UAPY na. Yes, contact precaution ang kailangan nating i-maintain. Okay? Sige. Punta tayo sa tinatawag nating herpes virus. Punta tayo sa ating herpes virus. So, ang herpes simplex virus can affect yung external genitalia. Pwede rin makita ito sa vagina, pwede rin sa cervix, right? And it could cause yung tinatawag nating painful vesicle. Isa sa mga hallmark or classic manifestation ng herpes is the presence of painful vesicles. Dalawang klase ng herpes. HSV1 at saka HSV2. Kapag ka lips at saka mouth, herpes simplex virus 1 yan. Kapag ka nasa genital, ito ay herpes simplex virus 2. Ano ang mode of transmission ng herpes? Mode of transmission. Mode of transmission ng herpes is, yes, well done, contact. Dalawang klase, either direct or indirect. Direct, of course, kapag sexual contact. Kapag indirect, it's happening through yung tinatawag nating contaminated article. Or in some instances, tinatawag ito sa exam na vehicle-borne. Vehicle-borne. Nangyayari yan halimbawa kapag nagsishare kayo ng vibrator. Okay? Moral of the story, wag mag-share ng vibrator. Wag may share ng vibrator. Okay? So direct and indirect contact yon. So, ang virus usually natatransmit yan sa baby during birth through the infected vagina or pwede ring ascending infection, lalo na kapag nag-rupture yung membrane tapos nag-pelvic exam ka pa. So, ang lagi mong dapat tatandaan, no vaginal exam. No vaginal exam ang dapat mong gawin kapag meron silang active herpetic lesions. Okay? Herpes can either cause death sa baby or could cause severe neurological impairment doon sa newborn. Question, ano ang mode of delivery? NSD or CS? NSD or CS? Laging CS, especially kapag ka mayroong active herpetic lesions. Anong klase ng precaution ang dapat mong i-maintain? Klase ng precaution na dapat mong i-maintain. Contact precaution. Okay, last question na lumalabas sa exam. Ano ang drug of choice? Ano ang drug of choice? Yes, acyclovir. Tanong, naku-cure ba ng acyclovir ang herpes? Can it cure? Yes or no? Can it cure? Yes or no? Hindi. It will only shorten yung duration ng course ng duration ng itong virus na ito, but it can never treat it. Sino-shorten lang niya. Okay? Any questions with maternal infection? Any questions with maternal infections? Question? Okay pa tayo, ha? Okay pa? Walang question? Sige. All right. Are vaccines considered teratogenic? Yes or no? Are vaccines considered teratogenic? Some of them, yes. So, dalawang klase usually ng form ng vaccine. Inactivated at saka yung live attenuated. Okay? Pag sinabi nating inactivated, yung vaccine, patay na yon yung organism na inilalagay nila doon sa vaccine. Pag sinabi mong live attenuated, buhay yung microorganism, medyo weakened lang siya. Okay? Ang hope ng vaccines is that your body would develop antibodies against it, right? And next time you are exposed to that, you already have some sort of protection. Okay? Ang problema lang, di ba sabi nga natin, may some levels sila ng immunosuppression. So yung dating immune response ng katawan mo nung bago ka magbuntis is not as effective kapag nagbuntis ka. Alright? So between the two, live or inactivated, anong usually ibinibigay sa mga nanay? Live or inactivated? Type tayo sa chat. Live or inactivated? Inactivated. Why? Live attenuated are known to be teratogenic in nature. Ano ba yung mga teratogenic na vaccines na yan? Okay? First is yung oral polio vaccine. Ito yung tinatawag na Sabin. Para matandaan mo siya, oral polio vaccine, Sabin, Sabibig. Sabin sa bibig, hindi pwedeng ibigay sa mga buntis na babae. Ano ang pwede mong ibigay kung sakaling kailangan mong magbigay ng polio vaccines? Sa bibig mo. Ano ang pwede mong ibigay sa kanila? Pwede mong ibigay si IPV. Yeah? Si IPV is yung inactivated form ng polio vaccines. It's usually given as shots. Ang tawag sa kanya, SOC. Okay? Sabin, yung oral polio vaccine. Pero kapag inactivated, SOC ang tawag sa kanya. Usually binibigay yan as shots. Okay? Ang BCG is also considered live and teratogenic vaccine. Varicella, HPV, pag influenza, ang influenza nasal spray, live attenuated form ito. Ang pwede mong ibigay na influenza vaccine sa nanay is yung ibinibigay ng shots. Okay? So yung inactivated form ng influenza, yun ang pwede mong ibigay sa nanay. Nasal spray, no. Okay? Measles, mumps, and rubella, pati yung regular measles, are considered live attenuated. Teratogenic din yan siya. Okay? Sige. Alright, okay lang ba na mag-break lang tayo ng very, very light? Okay lang? Siguro, ano na ngayon? 7:30 na ba dyan sa Pilipinas? 7:30 na? 7:30. Balik tayo ng 7:45, okay lang? Balik tayo ng 7:45? Sige. 3:45 dito, balik tayo. Wait lang ha. See you later! Okay, I'm back. Hello. Okay, sige. Alam mo, lulubat na ako. Wait. Kung alam ko. Just me. Okay. Ito pag matanda na ang frozen. Sige, ito ligad. Wait lang. Okay. Sige. Ayan. Okay, natapos na tayo sa maternal infection and vaccines. Now let's go to alcohol. Okay, question. What are the vitamins na nagdi-deplete kapag nagkukonsume ka ng alcohol? Anyone from the chat? What are the vitamins that are depleted when you consume alcohol during pregnancy? Vitamin B, particularly B1 and, well done, B1 and B9. B1 is thiamine and B9 is folic acid. Question, is folic acid an essential nutrient to facilitate neural tube development? Yes or no? Yes. Now, if there is deficiency, in the level of folic acid, could it cause neural tube defects? Yes. Particularly, yung tinatawag nating microcephaly, di ba? Kapag maliit ang brain mo, that could mean learning disability. Ang epekto nito sa bata is yung tinatawag nating fetal alcohol syndrome. So, ang kailangan tandaan dito, if folic acid is not absorbed by the mother, it can alter the brain development leading to microcephaly and learning disability. And there are certain manifestations na pwede mo pang makita sa mga batang may fetal alcohol syndrome. Ano yun? Meron silang small palpebral fissures, meron silang epicanthal folds, makikita mo smooth yung kanilang philtrum. Kaya wag mo paniniwalaan yung sabi ng kapitbahay nyo, aswang yan. Kasi smooth daw yung dito. Hindi yun aswang. May fetal alcohol syndrome lang yung bata. Meron silang tinatawag na thin upper lip. Meron silang tinatawag na thin upper lip. Meron silang minor ear abnormality. Meron silang micronathia. Ano yung micronathia na yon? Small or underdeveloped na jaw. Underdeveloped jaw. Meron din silang tinatawag na low nasal bridge. Oh, ha? Fuck. Thank you, Lord. Oy, totoo yan. Hindi yan, hindi yan operada. Natural po yan. Pinagpapasalamat ko lang po na nakuha ko po ang ilong ng nanay ko. At hindi ang ilong ng tatay ko, kundi hindi kayo magagandahan sa akin. Nyongit ko. All, yes. Thank you. I want to thank my mother for giving me good genes because my father's genes is... Charot lang, pero mahal ko nanay. Mahal ko yung tatay ko. Okay, so that's fetal. Ilong ko parang kalabasang maliit. Okay lang yan. Love your own. Okay? Yun din ang problema ko sa katawan ko eh. Sabi ko pa dati, nung bago ko dito sa UAE, ano daw, sabi ko, ano ba yan, kain ako ng kain, hindi ako tumataba. Puta ngayon, tumitingin na lang ako sa sa cake, tapos 5 pounds agad ang itataba ako kinabukasan. Charot. Love your own. Okay? Be comfortable with your own skin. Requirement yan. Kapag dumating ka na sa edad na katulad ko, dapat love mo yan siya. Okay? Kasi wala namang ibang magmamahal sa'yo bukod sa kapitbahay mo, kundi sarili mo. Okay, next is cigarette smoking. Tanong, ano ba ang content ng cigarette? At bakit harmful ito sa baby? Yes, nicotine. Will nicotine cause vasoconstriction or vasodilation? Constriction or dilation? Constriction. Ano bang mangyayari kapag pag mayroong vasoconstriction? This could cause yung tinatawag nating poor placental perfusion. Alam naman natin, kapag may poor placental perfusion, yung baby, meron siyang low birth weight. Kapag nagsisigarilyo ang nanay, meron silang tendency to have failure to thrive. Okay? Isa pa na risk factor for SIDS or sudden infant death syndrome is cigarette smoking sa nanay. Okay? Pag lumabas yung question about sudden infant death syndrome, usually ang tinatanong dyan is ano ba yung hallmark sign? Kapag kinuha na ng i-embalsa mo yung baby, ay yung baby, yung patay na baby na may SIDS, ano? Isa sa mga nakikita sa kanila is yung tinatawag na blood streak in the mouth. That's one of the hallmark sign ng SIDS. Okay? Next is metal and chemical hazards. So, metal and chemical hazards places the pregnant women at risk for poisoning. So, yung mga babaeng nagtatrabaho sa construction site or yung mga nagtatrabaho sa factory, for example, they need to be they need to be protected as well from teratogens. One is yung tinatawag nating arsenic. So arsenic exposure during pregnancy has been linked to a various range of adverse pregnant outcomes and some developmental issues. Sinasabi that si arsenic can interfere with deformation and differentiations of organs and tissues, leading to malformation, growth restriction, and even functional impairment sa developing fetus. Lead, on the other hand, is known for its neurotoxic effects. Particularly, it can interfere with the normal growth and maturation ng mga neurons. Kapag nagkaroon daw po ng problema sa pag-form ng at saka maturation ng neurons, nagkakaroon ng epekto ito sa connectivity at saka function ng mga neurons na yon. This could lead to neurodevelopmental disorders, learning disabilities, and even some sort of behavioral issues sa mga nanay na na-expose sa lead during pregnancy. Mercury, on the other hand, ang damage naman nito nasa DNA. DNA damage can disrupt yung normal cellular process, na i-interfere niya yung cellular division at saka differentiation, leading to a number of developmental abnormalities. Okay? Next, radiation. Ma'am, kahit ba X-ray, radiation ng X-ray considered teratogenic, yes or no? Yes. Next, radiation in any form, kahit X-ray, is considered teratogenic sa mga baby. How? Si radiation causes direct damage sa DNA within our cells. Kapag nag-interact yung radiation sa cellular DNA, it could lead to breaks, to mutation, even alteration ng genetic material. Kapag nagkaroon ng exposure dito, madidisrupt yung normal cellular processes, yung makaka-interfere sa cellular division at saka differentiation, potentially resulting to abnormalities or developmental abnormalities sa mga fetus. Tanong, nurse ka daw na nag-a-assess sa mga pasyenteng women, female women in their reproductive years, scheduled for X-ray of the chest. Ano ang priority mong tanong? Anong priority na tanong mo kapag female within reproductive years ang nag-present for ano daw siya, for chest X-ray? Anong itatanong mo? Nurses, gising-gising, ano ang kanilang last menstrual period? Anong tinatanong mo? Yung first day ng last menstrual period or yung last day ng last menstrual period? First or last day? First day. Right. Isa pang question. Kung ikaw ay charge nurse, nag-a-assign ka ng assignment sa mga staff, pwede ka bang mag-assign ng pregnant na staff sa mga pasyenteng may radioactive implant or nagre-receive ng radiation treatment? Yes or no? No. So kahit yan ay radioactive implant or nagre-receive ng radiation treatment, bawal ang pregnant patient, bawal ang pregnant visitor. Pareho. Sa pangtanong na lumabas sa exam, ano ang total time ng exposure ng mga staff sa mga pasyente mong nagre-receive ng radiation treatment or may radioactive implant? Total of, yes, 30 minutes per shift. Kahit yung shift nila, 8 hours or 12 hours, dapat maximum na yung 30 minutes. And that 30 minutes applies for both staff at saka visitor. Sa pantanong, gaano kalayong distance ang i-maintain mo between a patient with radioactive implant? Ilang feet? Ilang feet? 6 feet, yes. Okay? Ulitin ko ha, radiation of any form is considered teratogenic. Next. Temperature extremes could also affect placental perfusion. How so? Sinasabi that extreme heat or extreme cold can affect maternal blood circulation and alter the oxygen supply to the developing baby. Kapag may insufficient delivery ng oxygen sa baby, it could impair yung growth and development niya, potentially resulting to severe birth defects, right? So kapag may exposure to cold temperature, it could cause constriction or dilation. Constriction or dilation. Cold temperature, extreme cold. Type sa group chat. Constriction, dilation. Constriction. So alam naman natin, kapag may vasoconstriction, nagnanarrow yung mga blood vessel, nare-reduce yung blood flow in various parts of the body. Yung constriction na yon could restrict the oxygen supply and the supply of nutrients to the developing fetus. Ano naman ang problema? Kung extreme heat naman, it could lead to excessive sweating at saka excessive dehydration sa buntis na babae. Kung may dehydration sila, it could have adverse effects sa nanay and could potentially affect yung fetal well-being ng baby. Bakit? Nadidisrupt yung normal fluid and electrolyte balance. Posibleng magkaroon ng complications. For example, reduced amniotic fluid volume. It could also impair yung fetal organ development. Ako alam ko sa sarili ko na hindi ako magsusurvive sa state na malamig. Ayoko maging hotdog sa ref. Hindi kaya ng bones ko. Kaya nga nandito ako sa UAE kasi pinapractice ko na yung buhay sa infierno. So far, kaya ko naman siya. Kaya ko naman siya, to-tolerate naman siya ng first time. Hindi, charot lang. Kasi naalala ko, pumunta ako ng Wisconsin so sa may bandang taas, usually sa mga taas yun yung New York, Minnesota, Wisconsin, yan ang mga malalamig na lugar Okay? Punta ako November, hindi pa nga masyadong kalamigan nun As in, hindi pa talaga yung covered ng snow. Sakit ang katawan ko. Masakit ang buto ko. Hindi kaya ng person. Pang ano lang ako, pang California, Florida, yan. Kaya ko yung mga ganung klase ng temperature. Kasi, November, nung punta ako, hindi na masama. Parang ano lang, parang temperature sa Baguio. Hindi na ganun kalamig sa Baguio Pero kaya ng person yon. Okay? So kung sakaling pupunta ako, doon ako pupunta. Total nandoon ang aking lisensya. NCLEX ako California. Pero wag muna. Saka na, pagka tapos ko na yung mga anak ko. Nag-aaral pa kasi sila para kahit anong maging buhay ko sa Amerika, wala na akong iisipin papadala ng pera. Tatapusin ko muna silang mag-aral. Tsaka hinihintay ko yung asawa kong pumasa ng NCLEX. Kasi alagay, ako lang magbe-bedside. Sakit kaya ng likod ko. Dapat dalawa kami, hindi pwedeng ako lang. Pagka pumasa na siya, saka na ako aalis. Say ko lang siya. Okay, next. Can maternal stress be considered a teratogen as well? Lahat naman tayo stress, di ba? Can it be considered a teratogen as well? Practice makes perfect. Yes. Kasi kapag ka nagkaroon ng extreme stress, maternal stress increases catecholamines sa katawan ng isang pasyente, right? Kapag nag-increase ang catecholamines, nagpo-promote ito ng fight and flight responses, right? So, posibleng mag-cause ito ng vasoconstriction, it can affect organ and fetal development. Usually, ang mga babaeng stress during pregnancy, yung mga anak nila, meron tinatawag na failure to thrive. Failure to thrive, okay? So, it's in your best interest na as much as possible, i-regulate yung, kasi hindi mo naman maiwasan ng stress sa buhay mo eh. Tama? Pero wag naman daw po extreme or continuous. Lastly is drugs. Pag-usapan natin yung ang ating mnemonic dito is Terato. Pasensya na po. Hindi na makaisip si Ma'am Ansel ng drug sa GEM. Hanggang Terato lang. Okay? Starting off with letter T, thalidomide. In the 1950s and 1960s, thalidomide is actually given to pregnant women as a treatment for morning sickness. However, studies shows, siguro mga 70s, 80s yan na-discover nila, that there's a significant number of women who were taking thalidomide during pregnancy that delivers babies with amelia or phocomelia. Doon nila ngayon na found out na thalidomide, though hindi niya napapatay yung baby sa loob, it could cause extreme problems sa development ng kanyang extremities. That's why they stopped using thalidomide for treatment of morning sickness. Nowadays, it's used to treat skin condition, yung tinatawag nating Hansen's disease, or in other term or in previous term niya, yung leprosy. Tingnan mo itong lintik na pusa ito. Ginagamit din ito for treatment of some form of cancer. Kung tawagin natin is multiple myeloma. Okay? Thalidomide could cause amelia or phocomelia, kaya considered siya as teratogen. Next is letter E. E for anti-epileptic drug. It is said that some anti-epileptic drugs, or yung tawagin is AEDs, particularly valproate, are known to... Anong kinakain mo? Pistik ka. Anong kinakain mo? Wisit kang pusa ka talaga. Bumaba ka nga dyan. Kulit. Ito siya. Show me. Show me ka daw, baby. Hello. Ako po ang pretty short hair. Pulot lang po ako ng tatay ko sa ilalim ng kotse. Hello. Kulit ka lang. Gigigil ako. Sorry naman, guys. Ang kulit niya kasi kung ano kinakain niya. Kaya ang pusa na mahal yan sa Pinas. Ah? Really? Wala. Napulot lang yan siya ng asawa ko ng ano. Nasa ilalim siya ng kotse. May isang araw, late na umuwi yung asawa ko. Usually kapag Friday, maiksi lang ang ano nila, ang clinic hours nila. Usually mga alas 11, alas 12 nandito na siya. May lintik na iyon. Anong oras na? Alas 6 na yata umuwi, alas 4, alas 5. Tapos pag uwi pa niya, pawis na pawis. May bitbit siya niya. Nakakuha akong pusa. Sabi ko, lintik ka, bakit ka inabot ng ganun katagal? Hinanap pa raw niya kung may may-ari. So far naman wala. Ngayon siya, aming baby. Meron nga lang siyang FIP. Alam niyo FIP? Sakit nila yung feline infectious peritonitis. Pero magaling na siya. Binigyan lang siya ng gamot ng doktor. Medyo mahal lang, pero worth it naman. Sabi nga nung doktor kung hindi daw namin siya napulot, mas maaga pa daw natsugi ang fur baby. Kaya lang dahil naalagaan ng tama, nabigyan ng maayos na pagkain, naman siya. Malaki na siya, tapos makulit na yun, yung gigigil na yung kulit-kulit. Okay, asan na ba ako? Nawala na tuloy. Okay? So, may mga anti-epileptic drugs, particularly valproate, nakaka-apekto sila sa metabolism ng folic acid. Alam naman natin, di ba, ang folic acid is a crucial nutrient for neural tube development. So kapag merong inadequate levels ng folic acid sa katawan mo because of use of anti-epileptic drugs, it could cause increased risk of neural tube defect, particularly spina bifida sa mga growing fetus. Tanong, ano ang pinaka-safe na pwede mong ibigay na form ng anti-epileptic drug during pregnancy? Anong pwede mong ibigay? 60,000. Grabe, ang mahal naman. Magnesium sulfate. Yes. Okay, well done. Next is letter R, yung tinatawag nating retinoids or yung mga vitamin A derivatives. Ito yung mga anti-acne medication. Di ba kaya nga tinatanong ka bago ka mag-undergo ng acne treatment, do you plan on getting pregnant in the next 6 months? Kasi prolonged and exposure to high dose of retinoids, particularly sa first trimester of pregnancy, has been associated to a group of defects called retinoid embryopathy, kung saan meron silang yung tinatawag nating craniofacial abnormalities, usually cleft lip at saka cleft palate. Yun ang mga particular na problema dyan. There are also instances of cardiac defects or heart defects. Posible rin silang magkaroon ng CNS malformation. Pwede rin silang magkaroon ng mga limb abnormalities and other forms of structural abnormalities. Okay? So, retinoids yon. Next is anti-hypertensive. Okay? So, there are certain anti-hypertensives, particularly those that work by reducing blood pressure or altering yung vascular tone natin. It affects maternal blood flow to the placenta. Paulit-ulit nating sinasabi, insufficient blood flow to the placenta could compromise the level of oxygen and nutrient delivered to the baby, potentially leading to growth restriction and other complications. Question, ang ACE inhibitor ba contraindicated sa pregnant woman o hindi? Yes or no? Contraindicated, yes or no? Yes. ACE inhibitors are considered contraindicated, antihypertensive. ACE inhibitors are considered contraindicated for pregnant women because it could cross placenta and directly affect yung developing fetus. Pag na-expose sila sa ACE inhibitor, especially during the first trimester of pregnancy, it's associated with a risk for congenital malformation. Particularly sa heart or sa cardiovascular system. Usually, mga klase ng heart defects is yung tinatawag nating hypoplastic left heart syndrome. Pwede rin silang magkaroon ng pulmonary atresia. Pwede rin silang magkaroon or maapektuhan yung development ng great vessels. Or yung transposition of the great vessels, for example. Yun ang mga example niya. So, apart from congenital malformation, it also affects yung kidneys or yung function ng fetal kidneys, right? So, kapag may prolonged exposure ng ACE inhibitors during pregnancy, it could actually lead to tinatawag nating oligohydramnios. Kapag may oligohydramnios sila or yung reduced amniotic fluid, it could cause compression and even malformation of developing fetal organs, particularly yung lungs ng mga baby. Ano daw po ang pinaka-safest na anti-hypertensive na pwede nating ibigay? Hydrolazine. Okay? Sige. Next is tetracycline. Ano ba ang tetracycline? Antidepressant or antibiotic? Tetracycline is what? Antidepressant or antibiotic? Antibiotic, okay? So tetracycline is an antibiotic, but it can interfere with the development of fetal bones at saka teeth. Yun ang problema ng exposure to tetracycline eh. Kasi si tetracycline, it has a high affinity to, it has a high affinity for calcium And there's a tendency na magkaroon siya ng chelation with calcium ions. Ano ngayon ang mangyayari kapag may chelation ng calcium ions? It would lead to the formation ng insoluble complexes. Kapag merong ganon, it could lead to tinatawag na impaired bone growth at saka mineralization, leading to skeletal abnormalities or sometimes permanent discoloration ng teeth, yung tinatawag na dental staining. It's also contraindicated because tetracycline increases the risk of yung tinatawag nating hyperbilirubinemia. Okay, it affects the liver function in the developing fetus. It could lead to liver enzyme abnormalities and can interfere with the normal metabolic process ng liver, which could cause liver damage eventually. Tanong, ano ang pinaka-safest na antibiotic ang pwede mong ibigay sa pregnant women? Safest antibiotic is penicillin. Well done. Penicillin. Well done. Okay. Next is letter O. Dalawang klase ng letter O natin. Umpisahan muna natin kay OHA or oral hypoglycemic agent. Oral hypoglycemic agents. Ito mga medication na ito, it's actually designed to lower blood glucose levels sa mga pasyente mong may diabetes. Kapag ito ay taken during pregnancy, they can actually cross the placenta and reach the developing fetus. Excessive lowering ng fetal blood glucose levels o yung tinatawag nating fetal hypoglycemia can negatively impact yung development ng baby sa loob and could potentially lead to adverse outcomes. May mga instances pa nga na may mga oral hypoglycemic agents, particularly sa first trimester of pregnancy, yung kung tawagin nilang glyburide, may mga studies na nagli-link na kapag ginamit daw itong oral hypoglycemic agents na ito, it could cause congenital heart defect sa mga bata. Okay? Now, ano ang pinaka-safest na pwede mong ibigay to control yung blood glucose level during pregnancy? Insulin. Yes, well done. Insulin ang pinaka-safest nating ibigay. Next, isa pang letter O is yung tinatawag nating oral contraceptive pills. Ang oral contraceptive pills, hindi yan nire-recommend na gamitin during pregnancy. Kung ang babae nabuntis despite taking oral contraceptive pills, they are generally advised to stop or discontinue the use of OCPs. Dahil si OCP, dinesign yan para ma-prevent ang pregnancy. Paano niya na-prevent ang pregnancy? Ina-alter niya yung level ng hormone sa katawan, preventing therefore ovulation. Kapag continuous ang use ng oral contraceptive pills, it can interfere with the normal hormonal changes na nakakaapekto sa development ng baby sa loob. It may also cause yung tinatawag nating premature labor when it's taken during the late periods of pregnancy. And last, letter O, is yung tinatawag nating opioids. Okay? Question. Ang opioids ba, kapag in-abuse ng nanay, technically speaking, parang nag-a-addict na rin yung bata kahit hindi nila gusto? Yes or no? Resident choice nagko-cross kasi yun ng placenta. So, kung nagko-cross siya ng placenta, ang problema ba ng pagtitake ng opioids nakikita during pregnancy or after delivery? During or after? Type nyo nga sa chat. During or after? After. Because when the baby is born, suddenly kinakat mo yung supply ng opioids from the maternal circulation. They will then start to develop withdrawal symptoms. Ito yung tinatawag nating NAS or neonatal abstinence syndrome. Question. Is opioids a downer or upper? Downer or upper? They're considered downer. So kapag nag-withdrawal ang baby, lahat ng manifestation niya is up. Sneezing, feeding difficulties, sleep problems, tremors, seizure, high-pitched crying. Okay? Everything goes up kapag nagkaroon ng withdrawal. Okay? So, it is in the best interest ng pregnant women na hindi lang alcohol, hindi lang cigarette, pati drugs, iiwasan din niya kapag siya ay buntis. And lastly, yung tinatawag nating warfarin. Okay? So, warfarin interferes with the normal formation and functioning ng blood clotting factors during the embryonic and fetal development, right? Napaka-importante ng proper blood clotting, napaka-crucial niya sa development ng organs, limbs, at saka other structures sa katawan mo. Kapag na-expose ang nanay sa warfarin during this critical period kung saan nagkakaroon ng organogenesis, it could disrupt the development and increase the risk of structural abnormality sa baby. Ano ang pinaka-safest na anticoagulant na pwede mong ibigay during pregnancy? Yes, well done. It's actually heparin. Okay? Okay tayo dyan, ha? Any questions on tinatawag nating teratogens? Any questions before we go to the next bit? Question? May question? Gising pa ba kayo? Huwag niyo ako iwanan. Kinig kayo. Unti na lang. Sige na, please. Sige. Punta na tayo sa prenatal care, okay? Isa sa mga pinaka-common question na tinatanong during prenatal care is, ilan bang prenatal visit para ma-considered na normal siya? How many prenatal visit daw ang kailangang gawin ng isang pasyente para ma-considered na normal? Ilang prenatal visit? Okay, at least 4 sa mga first world countries. Okay? Pero kung ikaw ay galing sa developing countries, at least 5. Okay? Kailan usually nangyayari yan? Ang unang visit, kapag sila ay nagkaroon ng amenorrhea or pag na-miss nila yung period nila. Okay? Second, kapag nasa second trimester na sila ng pregnancy. Third is usually kapag nasa third trimester na sila ng pregnancy. Kapag na-term na sila or nagpunta na sila sa 36 weeks AOG, ang visit nila is every 2 weeks na. Okay? Yun lang naman ang usually lumalabas na tanong sa prenatal visit. Okay? Now let's look at the obstetric history. Let's look at the obstetric history. Hindi ko na siya masyadong i-deep dive, pero pasadahan lang natin siya. Pag sinabi natin gravida, the number of pregnancy, okay? Despite the abortion, including the current pregnancy. Pag sinabi naman natin para, the number of pregnancy daw that reaches the age of viability. Ano ba ang age of viability? Age of viability is 20 weeks AOG. Okay? Next is T-palm. Pag sinabi nating term, this is if within 36 to 40 weeks of pregnancy. Okay? Abortion, kapag number of preterm rather, kapag less than 36 weeks, abortion pertains to the number of terminated pregnancy before the age of viability, which is 20 weeks AOG. L, particularly, is the living children or the number of living children except the one that is inside the mother. And lastly is letter M, multiple pregnancy. Tanong, binibilang ba natin yung number ng fetus kapag multiple pregnancies? Yes or no? No. You do not count the number of fetus. May iba't iba pa tayong term na nako-consider or nakikita when it comes to the obstetric history. So kapag ka nire-refer ang pregnant women, they will, in the international exams, they will not tell you pregnant patient, gravida 2, whatever ganyan. Minsan nasasabihin nila sa'yo primigravida or multigravid patient or primipara, multipara patient. Okay? Nasa inyo naman na yung nasa inyo na naman yung tinatawag na handout, pasadahan nyo na lang siya. Okay? ang ifo-focus natin is yung assessment ng fetal growth. One of the things that we have to take into consideration when assessing patients in the antepartum period is the assessment of fetal growth. Let's start with the Nagel's rule. Sa Nagel's rule, ang hinahanap natin dito is yung estimated date of delivery or yung date of confinement. Okay? Ang ating formula dyan is -3 plus 7 plus 1. Okay? Very straightforward naman siya. Pag sinabi nating Bartolome's rule, you want to determine the age of gestation by checking the location ng fundus. You want to determine the age of gestation by checking the location of the fundus. Tatlo daw, specific na area ang usually tinitignan kapag pinag-uusapan natin si Bartolome's rule. Si symphysis pubis, si umbilicus, at saka si xiphoid process. It is said that these are marks that are used when we are assessing the patients. Pag lumabas ang tanong na ito sa exam, it's usually in the form of you are assessing a patient at 16 weeks AOG, pero yung location ng kanyang fundus nasa xiphoid process. Anong karaniwang cause kapag ganito ang nangyayari or kapag nakikita mo yung level ng fundus sa xiphoid process despite 16 weeks? Anong medical condition yon? It's called? Hello? Guys, inyo pa mga kayo? Yes, well done. Ferla, it's actually H-mole. So kapag mayroon daw rapid uterine enlargement, this could be associated with H-mole. We'll discuss more about H-mole kapag naandoon na tayo sa disorders. Now, pag sinabi naman nating McDonald's rule, you want to estimate the age of gestation by using the fundic height. May mga formula rito. Usually, kinukuha mo yung fundic height in centimeters. Kung gusto mong malaman yung age of gestation niya in months, multiply by 2 divided by 7, makukuha mo ang age of gestation in months. Kung gusto mo naman makuha ang age of gestation in weeks, fundic height in centimeter, multiplied by 8 this time, divided by 7, makukuha mo siya in weeks. Okay? Next, pag sinabi nating Johnson's rule, ine-estimate mo yung timbang ng baby sa loob. Ganun pa rin, fundic height pa rin ang basihan natin dito in centimeters, minus n times k. Si k is always 155. Always constant si 155 na yan. Si n, pwedeng 11 kung hindi pa engaged ang bata. Pero kapag siya engaged na, 12 ang ilalagay mo dyan. Okay? Pag sinabi natin engagement, yun yung settling ng fetal presenting part into the maternal pelvis or the ischial spine. Yun ang estimation ng Johnson's rule. Now, kapag ka naman Hayes' rule, ang ine-estimate mo dito is fetal length. At may mga rules dyan. Sinasabi na kapag first 5 months of pregnancy, kailangan mo daw i-square yung kanilang age of gestation para makuha mo yung estimated length niya. Ibig sabihin, 3 times 3, 9 centimeters. 5 times 5, 25 centimeters. Ganun ang kanyang computation. Pero, kapag 6 months and up, imbis na i-square mo, kailangan mo silang i-multiply by 5. Anong ibig sabihin nun? 7 months times 5, 35 centimeters ang kanilang estimated fetal length. Kuha? Kuha tayo dyan, ha? Sige. Apart from assessment of fetal growth, we are going to do prenatal care assessment. Loading na. Oo. Ganun talaga pag math. Akala nyo walang math, no? Kapag ka nursing, very, very wrong. Ako rin eh. Titinectus na ako. Huwag ka mag-alala, wala naman masyadong lumalabas na na computation kapag ka NCLEX. Very, very light lang. Unless, magkamali ka. Tandaan mo pag NCLEX ha, algorithm yan eh. Kung saan ka nagkamali, doon ka niya tatanungin. Parang yung masakwista mong boyfriend. Sa UK CBT, however, ayan, dyan madaming computation sa UK CBT. Pero usually, ang computation ng UK CBT, at least yung lumabas sa akin nung nag-exam ako, is mostly drug computation. So, kung halimbawa ganun pag NCLEX. Pag NCLEX kasi, ano yan paano ko ba sasabihin? Computer adaptive testing. So, meron, basic lang naman po ba yung UK computation? Sige, sagutin ko muna yung sinasabi ng isa sa NCLEX. So, kapag ka NCLEX, pag sinabing computer adaptive testing, meron yang logic sa back end. Kung saan ka mahina, yun ang laging lalabas na question. Okay? Tandaan mo sa NCLEX, ang tinitignan niya is yung minimum level ng competency mo. Tandaan mo ha, minimum lang. Minimum level ng competency mo, tinitignan niya, safe ka bang nurse o hindi. Okay? Halimbawa, sumagot ka ng easy question. Bigyan ka niya ng medyo very, very hard. Okay? Pag nasagot mo, on to the next question ka na or on to the next topic ka na. Malalaman mo na kapag mali ka, pag paulit-ulit yung sagot mo, buti nga ngayon NGN na. Ang format is, pagka sumunod na yung questions, makikita mong mali yung sinagot mo sa yung sa huli. Kasi malalaman mo na yung, sabi ka, yung pala yun, mali ako ng choices. Okay? Sa UK CBT naman, very, very basic lang ang computation. To be honest, hindi sa hindi sa pagmamayabang. Nung nag-take ako ng UK CBT, bakasyon pa ako nun sa Pilipinas. Nag-review lang ako siguro a night before or 2 nights before. Basta-basta lang ang version. Pumasa naman ako. So far, so good. Pumasa naman siya. Kung tutuusin, mahirap talaga ang format ng NCLEX kung ikukumpara mo sa UK CBT. Ang challenge lang kapag nasa ang UK CBT ka, yung OSCE pagdating mo na sa UK. Parang NLE lang ba, ma'am? Medyo mahirap na very, very light compared sa NLE. Ang dami ko ng exams. Minsan iniisip ko rin bakit ang dami-dami ko ini-exam. Wala lang, baka sakali, malay mo, matripang kong pumunta ng UK, o di may UK CBT ako, matripang kong mapunta ng US, may NCLEX ako. Ganun lang siya. Trip lang yan siya. Charot. Hindi, exam lang na exam ang first one. Para makaturo ako kayo. Paano ko kayo matuturuan kung hindi ako nag-exam, di ba? Charot. Ganun lang yan. Sige, huwag kang kabahan. Okay lang yan. Slightly a bit harder than NLEC, si UK CBT. Pero, para sa akin mas madali siya compared sa NCLEX. Magiging mahirap na lang siya pag nag-OSCE ka na pagdating sa UK. Kasi kahit yung mga words na ginagamit, yung spelling ng mga ginagamit nila is very different. Ako rin kahit nung bago ako dito sa UAE, naiintindihan ko yung American accent. Pero yung British, New Zealander particularly, Scottish, nabibingi ang first one. Ang daw. Bakit hindi ko yun learning sa Harry Potter? Mag-housewife na lang ako, ma'am. Ako din, sabi ko yun sa asawa ko. Sabi ko, masipag naman mag-work ang person. Pero kapag may opportunity maging trophy wife, why not? Charot lang. Okay, sige. Okay, tapos na tayo. Tapos na tayo sa sa prenatal assessment of fetal growth. Punta naman tayo sa prenatal assessment. Ang tatandaan nyo lang ditong mnemonic, Johnny English na lang po reference. Johnny English ba yung cartoon ba yun? Sorry naman, matanda na yung person, di ko alam kung ano yun. Ay, Johnny English si Mr. Bean? Yun ba yun? Ang alam ko lang na salita ni Mr. Bean, hello. Hello. Autistic tayo Pansinin mo, yung generation after natin, ang tatalino Di ba? Yung mga accent pang Peppa Pig. Tayo kasi puro Mr. Bean yung pinapanood natin. Yung batang ganyan, hello. Kuwang-kuwa ako, di ba? Monging-mongi. Hindi makakalaing pumasa ako ng 3 licensure exam. Hello. Okay, charot. Punta na tayo sa Mr. Bean tapos Pingu. Ano yung Pingu? Ano yung Pingu? Ay, pinggo, hindi ko alam yon. Hoy, hindi ako makarelate. Sorry naman. Matanda na ang first one. Ano yung pinggo? Ano yan? Hindi ko nga gets. Maganda din yun. Hindi ko alam. Bala kayo dyan. Hindi ko alam yung penguin na cartoon. Yun, ma'am. Ang naalala ko kasing mga cartoon na pinapanood ng mga anak ko, no? Nung nagpunta na kasi ako dito sa UAE, hindi na ako nanonood ng hindi na ako nanonood ng TV. Netflix na lang at saka YouTube. Tatandaan ko yung Fairly Godparents. Cow Chicken. Yung pinapanood ng anak ko dati. SpongeBob. Panood ng mga anak ko. So hindi ko alam yung pinggo. Bala kayo dyan. Malag sa pinggo. Alam ko naman kung ano ibig sabihin ng pinggo. Millennial kasi si ma'am. Millennial ba ako? Ay, in fairness, millennial. 1984 eh. Millennial ako. Hindi ako boomer Millennial ako. I think 84 ang first son. Wala pa akong 40. 39 pa lang ako. Next year na ako 40. Uwu. Sige. My gym partner, isa monkey, tapos flapjack. Hindi ko alam kung ano yon. Alam ko lang Dora the Explorer. Swiper, no swiping. Palaki dyan. Okay, sige. Move on na tayo. Punta tayo sa prenatal care assessment. Ang ating mnemonic na tatandaan is A, B, C, D, E, F. A stands for amniotic fluid leakage. Isa sa mga i-assess mo during prenatal, kapag nag-report, ito ganito yan. A woman can tell the difference between ihi at saka amniotic fluid. Kasi kahit nasabihin mong decrease ang kanilang bladder tone, they can still hold yung kanilang urine. But if the fluid keeps leaking, alam nila na ito ay amniotic fluid kasi hindi nila makontrol yung release. Okay? Kapag sinabi ng nanay sa'yo na nag-rupture yung kanyang bag of water, you always have to check yung rupture of membranes and to check for signs of labor. You also have to take into consideration at what weeks ba ng AOG nagkaroon ng rupture of membrane. Kasi kapag less than 36 weeks, you might want to take into consideration yung ability nila mabuhay extrautero given the current respiratory status that they have. Okay? Apart from that, you also have to be familiar with the characteristic ng amniotic fluid. Ang amniotic fluid is usually clear, right? Ang kanyang pH is usually alkaline, around 7, sabihin na natin, ang kanyang pH. Pag ginamit mo si nitrogen paper test, yun ay magiging color blue. Okay? In any case, kapag iba ang kulay ng amniotic fluid, halimbawa, blood tinge or pink ang color niya, greenish or brown, that could be indicative of or a sign of a potential complication. Okay? Prenatal assessment, amniotic fluid leakage. Next is yung tinatawag nating bleeding. Tandaan mo to ha? Whatever type of bleeding at any point during pregnancy, first, second trimester of pregnancy, is not considered normal. It could be indicative of complication. Ulitin ko, bleeding at any point of pregnancy, no matter how heavy or no matter how light, is always indicative of complication. Okay? Bleeding in the first trimester of pregnancy could be related to spontaneous abortion, for example. Bleeding in the latter part of pregnancy could be abruptio placenta or placenta previa. Regardless, kahit kailan siya nangyari, kahit gaano ka konti or gaano ka heavy yung bleeding na yon, it's always considered a problem or a sign of a complication. Okay? Next, ano ang tawag doon sa contraction that is painless, irregular, and infrequent na nararamdaman ng nanay during pregnancy? Braxton Hicks contraction. Tandaan mo, as pregnancy progresses, right? The contraction increases in frequency, duration, and intensity. You would know Braxton Hicks contraction between signs of true labor is that if the contractions increases in the intensity, in the duration, and in the frequency. Usually, ang Braxton Hicks contraction is typically felt as a tightening across the abdomen. Yun yan usually eh. Pero kapag ang contraction starts to become painful, minsan ano na siya umaabot na siya hanggang sa likod, that could be a sign of true labor. Okay? Pero kapag confined lang siya sa abdomen, hindi siya masakit, pero it could be uncomfortable. Okay? That could be just a regular Braxton Hicks contraction. Next, ang mga pasyente natin dahil meron silang some sort of immunosuppression, they are at risk for recurrent UTI. Okay? Very susceptible sila for urinary tract infection. Nurses, be careful not to confuse urinary frequency as a physiologic change of pregnancy versus a bladder infection. Frequency in urination, dapat walang kasamang pain, dapat walang kasamang fever. If the frequency of urination is associated with fever and is associated with dysuria, right? That could be a sign of urinary tract infection. Tandaan nyo yan. Next is edema. Now, is edema a normal part of the third trimester ng pregnancy? Normal ba yan sa latter part ng pregnancy or sa third trimester? Yes or no? Yes. Okay? Ang edema, kapag nangyari yan ng third trimester of pregnancy, is expected and normal. Again, sa pantalong, kung ang edema is confined on the lower extremities, is it considered expected at the third trimester of pregnancy? Yes or no? Yes. Sinasabi natin that edema is when excess fluids collect in the tissue. It's normal to have some amount of swelling, particularly sa lower extremities because of water retention. Edema that is happening on the third trimester of pregnancy, hindi ka masyadong dapat mag-worry. Okay? But if the edema happens anytime before the third trimester of pregnancy, for example, nangyari yan ng second trimester of pregnancy, and the edema is not confined in the lower extremity, pwede mo siyang makita sa face, pwede mo siyang makita sa lower extremity. Anong medical condition ito? Yes, well done, Trisha. This could be associated with pregnancy-induced hypertension. Tayo ha. Okay tayo dyan. Lastly, ito tinatawag nating fetal movement. Another way to assess fetal well-being, hindi lang fetal heart rate ha, another way to assess fetal well-being is to check fetal movement. It is said that women can feel quickening as early as 16 weeks. Pwede rin din siyang makaramdaman ng 20 weeks. It could also be as late as 23 weeks of gestation. Okay? The movements are intermittent, or kapag ka medyo may American accent ka, intermittent. And infrequent, okay? That's also a sign of fetal well-being. Now, apart from prenatal care assessment, you also have to be familiar with the danger signs of pregnancy. Kapag may chills and fever, that could be indicative of maternal infection. Kapag may cerebral disturbances, particularly headache, dizziness, pwedeng seizure, that could be a sign of pregnancy-induced hypertension or yung tinatawag nating eclampsia. Okay? Abdominal pain could be related to ectopic pregnancy. Pwede rin siyang cause ng abruptio placenta if that happens at the latter part of pregnancy. Blurred vision, blood pressure elevating, also related to PIH. Bleeding could be anywhere from abortion, from ectopic pregnancy, from placenta previa, from abruptio placenta, right? Swelling could be a sign of preeclampsia, especially kapag ka ito ay nanonote sa face at saka sa upper extremities. Sudden escape of fluid can be indicative of premature rupture of membrane. Premature rupture of membrane. Those are the danger signs of pregnancy. Okay? Any question bago tayo pumunta kay Leopold's maneuver? Leopold's maneuver. Question? Leopold's maneuver? Wala? Pwede na tayo mag-proceed? Okay. Si Leopold's maneuver, there are several reasons kung bakit natin ginagawa si Leopold's maneuver. First, it's actually done to determine fetal position. Sine-check din daw po natin yung fetal presentation. Sine-check mo din daw po yung level of engagement ng bata at saka yung kanyang attitude. Okay? Si Leopold's maneuver, bago yung mga procedure na ito, kailangan nating i-prioritize hindi lang yung comfort ng nanay, pati yung kanyang privacy. Okay? So you have to ask the mother to empty their bladder before the procedure to promote comfort. You have to provide privacy. Kung halimbawa, wala kayo sa isang room, hilahin mo lang yung kortina para ma-provide mo yung privacy ng pasyente. You also have to take into consideration infection control. Maghugas po tayo ng kamay after every patient interaction at bago ka pumasok doon sa room ng pasyente. Isa pa sa mga bagay na kailangan mong tandaan pag nagtatrabaho ka sa ospital, sinasanay ka na nila yung pakiramdam ng nasa morgue. Charot. Sobrang lamig pag nasa ospital. So make sure that you warm your hands bago mo hawakan yung iyong pasyente. Number 4, ensure that you have warm hands. Okay, question. Naalala ko yung, ano sabi? Naalala ko yung community kami, ma'am, nung nag-Leopold's, daming libag. Grabe sa judger ka. Hindi libag, pawis lang yun. Sobre you. Hindi lang nagkuskus yung nanay eh. Grabe to. Kasi juice. Okay. Ano daw ang best position sa Leopold's maneuver? Best position, mga kabayan. Best position is? Best position is supine. Ang problema, kapag naka-supine position ka, magkakaroon ng compression ng superior vena cava. Ano bang nangyayari kapag na-compress ang superior vena cava? Meron tinatawag na supine hypotension syndrome. Paano maiwasan si supine hypotension syndrome? Paano maiwasan si supine hypotension syndrome? Maglalagay ka ng pillow or towel sa kanilang right buttocks. Bakit kailangan? Para matilt yung mother to the left side at maiwasan or ma-relieve yung pressure ng gravid uterus over sa iyong superior vena cava. Okay? Sige. Isa-isahin natin yung mga different maneuver. Tatayo lang ang first one para mapakita ko sa inyo. Yes. Tanggalin lang natin yung kinatawag na oh, yun, gigigil ako. Tanggalin natin yung background para yan. Yan naman ako, di ba? Okay. Tanggalin ko lang yung upuan. Wet. Ayan. Okay. So first presentation, so first maneuver, ang dinidetermine daw po natin dito is fetal presentation. Okay? So, kapag ikaw ay nagagawa ng first maneuver, dapat nakaharap ka sa ulo ng nanay. Okay? Nakaharap ka sa ulo ng nanay. I-check mo kung ano ang nasa fundus. Check what is in the fundus. Okay. Kapag round, hard, firm, at saka nagmo-move independently sa body, ang nahahawakan mo ay head. Round, hard, firm, moves independently with the body. Ang nahahawakan mo daw ay head. Tanong, anong klase ng position? Cephalic o breech? Cephalic o breech? Cephalic o breech? Nahawakan mo ulo, ha? Breech. Tama? Kasi nahawakan mo sa fundus daw ay ulo. Breech siya. Puwet ang kanyang presenting part. Kuha? Now, upon assessing what's in the fundus, medyo hindi siya ganoon ka-well-defined. At kapag i-move mo, it moves with the body. Kapag daw siya ay buttocks, kung hindi siya or less well-defined, and it moves with the body, ang nahahawakan mo daw, puwet. Okay. Kung nasa top ng fundus is less well-defined at moves with the body, anong klase ng presentation? Cephalic or breech? Cephalic or breech? Cephalic. Kasi nakabaliktad na. Ito yung ulo ng bata, ito yung puwet niya. Ha? That's the first maneuver. Checking for pretal presentation. Kuha. Okay. Punta tayo sa second maneuver. Sa second maneuver, pagkatapos mo daw i-locate kung ano yung nasa fundus or i-determine kung ano yung nasa fundus, i-slide mo ang kamay mo sa magkabilang side ng abdomen ng nanay. Bakit? Kailangan mong i-locate. Locate the fetal back. Tanong, bakit mo kailangang i-locate ang fetal back? Bakit kailangan mong mahanap si fetal back? Hello? Bakit daw kailangan mahanap si fetal back? Kasi doon mo ilalagay yung stethoscope mo mamaya kapag inascultate mo na siya. Kaya kailangan mong hanapin ang fetal back kasi doon mo ilolocate ang stethoscope para kapag nag-auscultate ka ng fetal heart rate, malinaw ang marinig mo. Okay? So paano mo malalaman kung ang nakakapa mo ay fetal back or ang nakakapa mo ay knees and elbow? Kapag fetal back ang nakakapa mo, it's usually smooth, hard, at saka resistant. Okay? Kapag kinapa mo ito at ang nakakapa mo yung likod ng bata, usually smooth, hard, at saka resistant yan. However, kapag ang nakakapa mo ay knees at saka elbows, meron niyang tinatawag na angular nodulation. Kumbaga parang bukol-bukol. Bakit? Imagine mo yung itsura ng bata sa loob. Paano ba ang posisyon ng bata sa loob? Chin is towards the chest, right? The extremities is at the center of the body. Kaya kapag nakapa mo, yung likod ng bata, smooth, hard, and resistant. Pag ang itong side naman ito, ang kinakapa mo, syempre may nodulation. Kasi ito yung mukha ko, ito yung kamay ko, ito yung extremities ko. Yun yung angular nodulation na tinatawag. Kuha niya? Kuha tayo? Thumbs up? Pagkuha. Okay. Sige. Punta tayo sa third maneuver. Sa third maneuver, ang kailangan mo daw i-check dito is yung tinatawag na fetal engagement. Fetal engagement. This time, nakaharap ka na sa paa ng nanay. Okay? Pag sinabi natin fetal engagement, ito yung settling ng fetal presenting part. Pansinin nyo ha, hindi ko sinabing ulo, hindi ko sinabing fetal head. Kasi pwedeng ang presenting part ay puwet. Settling of the fetal presenting part into the maternal pelvis or yung kanyang ischial spine. Okay? Sige. It is said na kapag nakaharap ka na sa nanay, hawakan mo ito. Yung parang sa ilalim ng symphysis pubis mo. Hawakan mo dito sa may bandang, yan, sa may bandang ibabaw, yung kung saan mo makikita yung tabanan dyan mo. Ilalagay mo yung kamay mo doon sa area na iyon. Kapag napag-meet mo pa yung iyong kamay, kapag sara mo, no? Paglagay mo rito, sinara mo, at napag-meet mo pa yung kamay mo, it means that the baby is still not engaged. Manonote mo din na kapag sinarado mo yung kamay mo, parang nagfo-float pataas or parang umaakyat yung baby. Because the baby is still floating. Hindi pa siya naka-engage. However, kung siya ay engaged na, kahit ano pang magawa mo, parang may nakaharang sa gitna. Hindi mo na mapag-mimit yung kamay mo. It means settled na or engaged na yung baby sa loob. Third maneuver. Check for fetal engagement. Now, sa last maneuver, ang ating i-determine dito is fetal attitude. Ma'am, paano nyo po ba madedetermine yung attitude? Parang sama daw po ba ng ugali yan? Ano ba ibig sabihin ng attitude? Parang si Ma'am Ansel nyo ba yan? Maldita, charon. Pag sinabing fetal attitude, anong ibig sabihin? Ha? Pag sinabi nating attitude, yung relationship ng fetal body parts into one another. Anong ibig sabihin nun? Sinasabi that the baby inside should assume a well-flexed attitude. Anong ibig sabihin nun? Chin is towards the chest. The extremities is at the center of the body. Kailangan daw, ganito yung itsura ng baby sa loob. Para yung pinakamaliit na diameter ng kanyang ulo, which is the occiput, yun ang lalabas as fetal presenting part. Kuha niya. Kuha. Hello? Meron pa nagsasalita? Wala nga. Mag-mute lang po ang person. Mute lang natin yung iba. Pa-mute naman po! Hindi ko makita yung ano. Pa-mute. Ayan. Para hindi ko ma-confuse dun sa question. Sige. Paano mo ngayon i-determine yung attitude with just palpation? Okay? So hawak mo kanina, sabi mo kanina, pinag-meet mo yung kamay mo. Kapag pagka pinalpate mo siya at siya ay nag-i-slide and it doesn't meet any obstruction, pakiramdam mo parang yung bumbunan mo yung hinahawakan mo. So pag pinalpate mo siya at hindi nakakita ng obstruction or hindi naka-feel ng obstruction ng iyong kamay, it means that the baby has a good attitude or a well-flexed position. Ulitin ko ha, kapag nag-slide ka or nag-palpate ka doon, your fingers will slide and will not meet any obstruction. Paano ang posibleng mangyari kung halimbawang hindi occiput ang presenting part? May mga instances kasi na yung extremities nasa center ng body, pero instead na chin is towards the chest, naka-extend ang ulo or posibleng naka-hyper-extend pa siya ng ganyan. Kapag ang presentation ay brow, face, or yung kanilang chin, ulitin ko brow, face, at saka yung kanilang chin, pwede kang makamit ng obstruction side to side. Especially kapag ang presenting part ay face. Kasi ang nakakapa mo, itong kanilang brow, itong kanilang muka, o yung kanilang baba. Hindi ito. Kuha. So kapag ikaw daw ay nakamit ng obstruction, habang pinapalpate mo yon, either brow or tinatawag na face, chin, ang presenting part. Kuha? Kuha tayo? Gets yan ha? Thumbs up pag okay? Alright, see. Okay. Upo na ulit ang first one. Yun. Good spot. Okay. Sige. Lalagay ko lang yung background kasi baka makita yung mga sampay ko. Sunday kasi, naglaba ang first one kanina. Sige. Okay na tayo dyan, ha? Okay. Another thing that we have to assess during the prenatal period or during the prenatal assessment is yung fetal heart rate. Ang normal na fetal heart rate is yung 120 to 160 beats per minute. Pero dapat meron daw variability of about 6 to 25 beats per minute. Anong ibig sabihin nun? Minsan 120, minsan 126, minsan 130, minsan 140, ganon. Normal siya or considered siyang normal basta yung variability niya is within 6 to 25. Parang ito, nasa may bandang 120 siya, akit siya ng 140, pababa siya ulit ng 120, akit siya ulit ng 150. Basta, ang variability is between 6 to 25 wala tayong problema. Dangerous kapag ang variability is less than 5 beats per minute or walang variability at all. Pag walang variability, yan ang magiging problema natin, abnormal pattern yan, or very minimal siya. It could be indicative of use of narcotics, alcohol, or illicit drugs. Posible din naman na tulog lang yung baby sa loob. It could also be indicative of prematurity or fetal hypoxia. Okay? Now, that being said, may iba't ibang test na ginagawa para makita yung or ma-evaluate yung health ng baby, particularly their fetal heart rate. One of the things or one of the assessment na ginagawa is yung tinatawag na non-stress test. Ano ang ginagawa sa non-stress test? This particular test is done to see how their heart rate responds to their movement. Okay? How daw yung kanilang fetal heart rate respond sa kanilang paggalaw. Okay? This procedure takes about 20 to 30 minutes kapag ginawa mo siya. Okay? And usually, yung nanay, binibigyan sila or ina-applyan sila nung tinatawag nating uterine tocodynamometer. Anong ibig sabihin nun? Binibigyan sila ng button, ipipress nila yung button na iyon, kada mararamdaman nila na gumagalaw yung baby. Titignan ngayon ng system na ito or ng machine na ito, ano ba yung response ng heart rate ng baby habang siya ay gumagalaw. Okay? Ang normal, or isa sa mga bagay na kailangan nyo tandaan, kapag international nurse ka, there's a certain level of expectation that you understand and you know how to interpret laboratory values or diagnostic findings. Okay? Pag sinabi nating reactive ang non-stress test, it means that yung kanyang fetal heart rate nag-increase habang siya ay gumagalaw. Kaya nga pinapapindot nyo sa kanya eh. Right? Para makita habang gumagalaw yung baby, makikita mong tumataas yung kanyang heart rate. Okay? That is a reactive non-stress test. Okay? This is considered a normal finding. Ibig sabihin, nag-a-accelerate or nagre-react yung heart rate ng bata kapag gumagalaw siya, and that's considered normal. Okay? Now, kailan mako-consider na abnormal finding si non-stress test? Ang ating mnemonic is NNN. Non-reactive, non-stress test is not good. Anong ibig sabihin nun? Kapag walang variability, if there is no variability, hindi tumaas, hindi bumaba, or bumagsak ang kanyang fetal heart rate, it means na hindi niya na meet yung criteria na yon. That is when it's considered non-reactive. Ngayon, question sa exam. What do you do kapag non-reactive ang non-stress test? Check fetal heart rate or refer for further evaluation? Check or refer? Check or refer? Check or refer? Check or refer? Anyone from the group chat? Yes. Ang ating next action or ang ating step is to refer for further evaluation. Ito yung mga pasyente na after ng non-stress test, kailangan nilang mag-undergo ng another test called contraction stress test. Okay? Ano ngayon si contraction stress test? Contraction stress test or yung tinatawag nating oxytocin challenge test. Ito yung kapag bibigyan mo sila ng oxytocin para ma-stimulate yung uterine contraction. Tapos i-check mo ano yung response ng fetal heart rate kapag nag-contract yung uterus ng nanay. Now, there are two ways where you can administer oxytocin. Pwedeng natural, pwede rin namang IV or administration ng exogenous na oxytocin. Kapag natural, nipple stimulation. Huwag kang pala desisyon ha. Huwag mong i-stimulate yung nipples ng nanay. Huwag mo i-stimulate yung nipples ng nanay nang hindi niya alam. Baka magulat na lang siya. Hinawakan mo na lang bigla yung utong niya. Kanina mong pala inaabangan. I-stimulate natin yung uterus. Oo, wag pala desisyon ang person, okay? Kaya ko lang sinasabi sa inyo yung dalawang choices na yon kasi depende sa references. Kapag ang reference mo, Saunders, IV oxytocin or exogenous oxytocin ang binibigay. Pero pag lipin ko ang binabasa mo, nipple stimulation ang ginagawa, okay? Bakit daw there are facilities that would prefer administration of oxytocin naturally? Kasi alam naman natin yung mga adverse effect ng oxytocin, right? Pwede siyang magkaroon ng uterine perforation. Pwede rin daw po na magkaroon ng or mag-trigger ito ng premature labor and delivery. Imaginin mo, chinek mo lang yung fetal heart rate, nagtuloy-tuloy na yung labor ng nanay. Paano kung hindi pa ganoon ka-develop ang kanyang lungs, right? Posible rin magkaroon sila ng tinatawag nating hypertonic uterine contraction, yung sobrang lakas ng uterine contraction niya kahit ang konti-konti lang ng binigay mong oxytocin. Okay? So, ano ngayon ang interpretation mo ng oxytocin challenge test? The result is considered negative kapag ang fetal heart rate mo ay umincrease or nag-decrease during contraction. If the fetal heart rate increases or decreases during contraction, this is considered a normal finding. Later, titignan natin ano-ano ba yung mga different types ng tawag nito, ng fetal heart rate variability para makita nyo siya. Okay? Positive ang oxytocin challenge test kapag hindi daw nag-accelerate or nag-decrease ang fetal heart rate usually at the end ng contraction or after mag-peak ng contraction. Okay? Ulitin ko ha. Negative is normal. Either nag-increase or nag-decrease during contraction. Positive kapag abnormal, kung saan bumagsak yung kanyang fetal heart rate either pagtapos ng contraction or pagtapos mag-peak nung contraction. Kuha? Now, to further discuss on that, let's look at the mnemonics used for for fetal heart rate acceleration and deceleration. Malalas lumabas sa exam ito. VIL-CHOP. Variable deceleration is caused by cord compression. Early deceleration is caused by head compression. Acceleration or increased fetal heart rate is okay. A-okay. Late acceleration or late deceleration is caused by placental insufficiency. Okay? Sige. Para maintindihan natin siya, pag-usapan muna natin yung differences ng uterine contraction at saka mga different types or different parts ng uterine contraction. Sabihin na natin na itong mga ito ay uterine contraction. Pasensya na po, yan lang po ang alam ni Ma'am Cariasong i-drawing na uterine contraction. Okay? From the moment na relax yung uterus mo hanggang sa mag-increase yung intensity ng uterine contraction, ang tawag dyan ay increment. Okay? Yung peak ng uterine contraction, kung tawagin ay acne. Pagka bumaba naman na yung intensity ng uterine contraction, ang tawag dyan ay decrement. Okay? Sinasabi that early deceleration is one of the, kahit na technically speaking, bumabagsak kahit na technically speaking, bumabagsak ang fetal heart rate kapag meron siyang early deceleration, it's still considered a normal finding. Ano ibig sabihin dito? Sinasabi na makakakita ka daw ng early deceleration or makikita mo ang early deceleration kapag bumagsak ang fetal heart rate along with the uterine contraction. It almost as if it produces a mirror image. Anong ibig sabihin nun? Kung kailan nag-contract ang uterus, saka bumagsak yung kanyang fetal heart rate. But the moment na mag-relax na siya, babalik na siya sa normal. That is early deceleration. Early deceleration is caused by head compression. Though technically, mababa ang kanyang fetal heart rate or bumagsak ang fetal heart rate, this is still considered a normal tracing. Kuha nyo ha? This is still considered a normal tracing. Okay? Sa exams, hindi nila ipapakita sa inyo yung pangit na drawing ni Ma'am Cariaso. Ang drawing na ipapakita nila sa iyo ay talagang example ng tracing na nakukita nyo rito. Si early deceleration, makikita nyo para talaga siyang mirror image ng uterine contraction. Ito ha. Ito yung uterine contraction. Pansinin nyo, the moment na nag-increase siya is also the same time na nag-decrease yung uterine contraction. Nag-increase ang uterine contraction the same time na bumaba ang fetal heart rate. Increase ang uterine contraction, bumagsak ulit ang fetal heart rate. Kuha? This is caused by head compression. Though technically bumabagsak ang fetal heart rate, it's still considered a normal tracing. Kuha? Kuha tayo dyan ha? Thumbs up kapag kuha. Okay. Sige. Punta naman tayo sa late deceleration. Operahin ko lang to ha. Punta tayo sa late deceleration. Paano naman daw yon? Sige. Ito ulit yung uterine contraction mo. Okay? Si late deceleration, di ba sabi natin ito yung acne. Si late deceleration, nangyayari yan kapag bumagsak ang fetal heart rate at the peak of the uterine contraction. Bumabagsak lang daw ang fetal heart rate kapag nag-peak or after mag-peak yung uterine contraction. And this late deceleration is caused by tinatawag nating placental insufficiency. This is caused by placental insufficiency. Okay? Kapag ang pasyente mo naka-oxytocin at nakita mong bumagsak ang fetal heart rate at the peak or after the peak of uterine contraction, ang unang-una mong gagawin is to stop oxytocin. Kung sakali namang hindi mo siya binigyan ng oxytocin, nakahiga lang siya, pero biglang bumagsak ang fetal heart rate at the peak of uterine contraction, i-change mo ang kanyang posisyon. Ano ang posisyon? Left side lying position. Left side lying position. Next, kailangan kang mag-administer ng oxygen. Bukod sa oxygen, kailangan mong i-increase ang intravenous fluid para ma-improve ang circulation at saka ang perfusion. And lastly, kailangan mong i-notify ang healthcare provider. Tandaan, ang pagiging international nurse, hindi katulad ng pagiging nurse sa Pilipinas. Sa nurse sa Pilipinas, nakaasa tayo sa order ng doktor. Sa Amerika, sa ibang bansa, sa UK, expected na alam mo dapat ang gagawin mo. Pagkatapos mo nang gawin yung intervention mo, saka mo lang ino-notify yung healthcare provider. Ayos tayo dyan ha? Sige, tignan natin ito sa tracing, paano nangyayari ito. Si late deceleration, o tignan mo ha, kung kailan nag-peak yung uterine contraction, saka bababa yung heart rate ng bata. Kapag nag-peak ang contraction, saka bababa. Kapag nag-peak, saka bababa. Kapag nag-peak, saka bababa. Kuha niya, yun yung tinatawag na late deceleration. Thumbs up kapag okay? Okay, sige. Alright, punta tayo sa last na fetal heart rate variability, yung tinatawag nating variable deceleration. Paano naman yung variable deceleration? Ito ito yung contraction ng nanay, regardless kung nagko-contract o hindi, tataas, bababa, tataas, bababa, tataas, bababa, wala sa pakialam. Mag-contract man yung uterus mo o hindi, basta trip niyang bumagsak, babagsak siya. Okay? And that is caused by tinatawag nating cord compression or cord prolapse. Okay. Now, ano ang management mo kapag nagkaroon ng cord prolapse? Okay? Kapag ganyan, kailangan mong i-change ang position ng nanay to a knee chest position. Tanong, Nakita mo yung cord, nakaprotrude sa vagina ng nanay. Can I replace the cord back inside the vagina? Yes or no? Can I replace the cord back? No. Do not replace. Do not replace the cord back to the mother's vagina. Kasi imbis na walang problema sa oxygenation, lalong magkakaroon ng problema sa oxygenation. Tanong, pwede na ba daw po itong isend for emergency CS? Pwede na ba itong isend for emergency CS? Yes. Pwede na siyang, yes. Apply, not necessarily only petroleum gauze, pwede rin kahit yung, ano lang siya, basa lang siya ng NSS, i-apply mo lang siya para hindi lang matuyo yung cord. Tapos, isend mo na siya for emergency cesarean section. Okay? Cord compression or cord prolapse. Pagka tinanong ka sa exam, ano ang cause ng cord compression? Usually, nakikita yan sa mga pasyenteng may oligohydramnios. Diba alam nyo naman na ang amniotic fluid, dyan nag-swimming yung bata. Okay? Kapag konti ang amount ng amniotic fluid, pag nag-rupture ang membrane, posible siyang magkaroon ng cord compression or mag-cord prolapse. Okay? Sige, tignan natin siya sa tracing. Ang itsura ng tracing niya ganito. Ito yung uterine contraction, wala siyang pakialam. Basta babagsak na lang siyang biglang ganun. Okay, that could be a sign of cord compression. Sige, i-practice natin ang pagtingin ng mga different tracing. Ano ang expected sa dalawang strip na to? Si letter A o si letter B? Sagot sa chat, ano ang expected? Letter A or letter B? Letter A or letter B? Sagot sa chat, ano ang expected? Letter A or letter B? Letter A. Tingnan nyo, mirroring, oh. Anong tawag sa deceleration na to? Early or late? Early or late? Early deceleration. Anong cause ulit ng early deceleration? Placental insufficiency or head compression? Head compression. Well done. Anong klase ng variability ang nakikita nyo sa letter B? Late o variable? Late o variable? Late o variable? Late. Kasi tingnan mo, peak, bagsak. Peak, bagsak. Peak, bagsak. Peak, bagsak. Okay? Ano ang cause ng late deceleration ulit? Cord compression or placental insufficiency? Yes, well done. Placental insufficiency. Okay tayo dyan, ha? Sige, isa pa. Ano ang nakikita nyo sa strip na ito? Ano ang nakikita nyo sa strip na ito? Early, late, or variable? Early, late, or variable? Anong nakikita nyo sa strip? Early, late, or variable? Early, late, or variable? Mirroring pa rin. Early deceleration. O ha? Sige, well done. Punta tayo dito sa kabila. Anong nangyayari dito sa strip na ito? Early, late, or variable? Early, late, or variable? Early, late, or variable? Late pa rin. Ayan yung peak, oh. Dito siya babagsak. 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 Okay? Placental insufficiency, late deceleration pa rin ito. How about letter C? Ano ito? Early, late, or variable? Early, late, or variable? Nalilito kayo. Early pa rin. Tingnan mo, oh. Mirroring, oh. Mirroring. Early deceleration. Okay? Okay tayo dyan, ha? Tandaan, veal chop. Tandaan, veal chop. Sige, konting-konti na lang bago tayo mag-end. Tapusin ko lang siguro hanggang dito sa amniocentesis. Tapos, dismiss na tayo, ha? May sample strip po ba sa variable, ma'am? Meron, teka. Hindi nyo ba nakita? Meron ba akong sample strip niyan? Variable deceleration. Ito. Hindi ko alam kung bakit hindi siya nakikita. Wait lang, ha? Nasaan na yun? Anong page pa yun? Bakit mo ba hinide, oy? Sige. Saan napunta? Ayun. Sige. Kita nyo? Siya, lola ko, taga Samar. Konti lang yung alam ko. Saan ka sa Samar? Yes. Saka sa summer, Katbalogan, Kalbayog naman ako. Kaya maldita ang first son. Kasi ako ay, well, halo-halo eh, may mix eh. Pero ang lola ko, galing Kalbayog. Kaya malala yung pagiging waray ko. Kaya pag nagmaldita ka sa akin, maldita rin ako. Waray-waray. Hoy, may upay naman ang first one. Grabe siya. Hindi ko alam yung maisog. Kita niyo ba yung screen? Ay, nawala yata yung screen ko. Nawala? Nyari, ba't nawala? Sige. Siya na punta yung version. Wait. Kadyot lang, day. Okay. Kita niya? Kita niyo yan? Ayan. Okay, sige. Yan ang example ng, yun. Okay, ayan example ng late deceleration. Ay, hindi pala. Variable deceleration. Ito siya. So, dito. Ayun. Nakita niyo yan? Wala siyang pakailam. Kahit kailan ka sa babagsak siya. Huwat ramo kay masuko dayon si ma'am. Di ko alam kung ano ibig sabihin ng balak sa buhay. Hindi ko siya alam. Okay, sige. Alright. Apart from that, another type of assessment that sabi ko kanina, di ba? Isa pa sa mga assessment ng fetal well-being is yung movement ng bata. Okay? So, dalawang klase ng assessment ang usually ginagawa dyan, si Cardiff method at saka si Sandowski method. So, si Cardiff method, usually, minomonitor ang fetal movement for about an hour. Monitor for an hour. And it's expected at least meron siyang 10 movement within that time period. Si Sandowski naman, ang kakaibahan niya lang kay Cardiff, ginagawa ito after eating. Pinapakain muna yung nanay. And it is said that there should be at least 4 movements 1 hour after eating ng nanay. That could be a sign of fetal well-being. Okay? Now, si biophysical profile, hindi ko na siya isa-isahin, pero kapag lumabas ito sa examination, lumalabas siya as SATA or select all that apply, tapos puro components yung lumalabas. So, iwan ko na yan sa inyo para basahin nyo at tignan nyo siya. Kung lalabas din siya, bukod sa select all that apply, ang tinitignan dito yung scoring lang din. Kapag ang score mo, 8 to 10, that's a good score. Pero kapag ikaw nasa 6, it could be suspicious. Medyo delikado pa yung position ay yung condition ng baby. Kapag ka daw 2 to 5, that could be indicative of fetal jeopardy. Ito yung tinatawag nating fetal APGAR. Huwag niyong i-confuse ito sa newborn APGAR, ha? Ang newborn APGAR, ang grading 0, 1, 2. Si biophysical profile, 0 tsaka 2 lang siya. So, iwanan ko na yan sa inyo para mabasa nyo. Alright? Next, bukod sa mga different tests, meron din pa tayong mga diagnostic tests na pwedeng gawin dyan, starting off with the chorionic villi sampling. Ma'am, permission to leave po, may emergency lang. Okay, sure, ingat ka. Para matandaan ninyo, si chorionic has 9 letters. Usually, ginagawa ito at the 9th week of pregnancy. It's an alternative for amniocentesis para ma-diagnose yung presence ng different types of genetic abnormalities. Okay? Yung procedure na ito, usually na-accomplish yan by needle aspiration of the sample chorionic villi. Pwedeng trans-cervical or trans-abdominal using yung kanilang pusod. Okay? Tanong, pag lumabas ito sa exam, is RH incompatibility a complication of chorionic villus sampling, yes or no? Type sa chat. Is RH incompatibility a form of a complication ng procedure na ito, yes or no? Huwag mo na kayong sumama sa dilim. Ang dali lang, dandapusin ko lang. Is this a complication of RH incompatibility? No. Well done. Hindi siya problema. Bakit? Wala namang blood mixing eh. Hindi naman nagmi-mix ang blood ng nanay at baby. Kaya nga alternative siya for amniocentesis. Although, kailangan mo pa rin i-watch out yung bleeding after the procedure. Tapos ang mga nanay, usually, naka-complete bed rest yan after gawin itong chorionic villus sampling na ito. Okay? Next, yung amniocentesis. Si amniocentesis is another form of prenatal testing kung saan kumukuha ka ng small amount ng amniotic fluid para gumawa ng iba't ibang klase ng testing. Different tests can actually be performed with the sample of the amniotic fluid, pero mainly, ginagawa ito to look for certain types of defects, particularly chromosomal anomalies. Kung gusto mong tignan kung may possibility ba ng Down syndrome, usually ginagawa itong amniocentesis na ito. Pero pwede mo rin siyang i-determine yung gender through a process called karyotyping. Nache-check din dito yung presence ng chromosomal anomaly. Kaya nga nakikita niya si Down syndrome. Chine-check niya rin yung presence ng neural tube defects. Chine-check niya rin yung fetal lung maturity. Chine-check niya rin yung fetal lung maturity by checking yung tinatawag na lecithin sphingomyelin ratio. Okay? Doon niya makikita kung matured na yung fetal lung or hindi. This is considered an ultrasound guided procedure. And there is a possibility of blood mixing kasi baka mamaya ang matusok mo is yung umbilical cord ng bata. Okay? So ang priority mo kapag ang pasyente mo ay nag-a-amniocentesis, ang ating priority is yung safety, right? Hindi lang ng nanay, pati yung bata. Question, kapag nag-a-amniocentesis, empty bladder o hindi? Empty bladder o hindi? Empty bladder, yes or no? Dapat empty bladder. Well done. Now, since there is a possibility of blood mixing, anong pinaka-importanting question na itatanong mo sa nanay? Anong importanteng question na itatanong mo sa nanay because of the possibility of blood mixing? Possibility of blood mixing. Ano i-check mo? Itatanong mo ano ang kanyang blood type. Yes. Dahil may risk ng RH incompatibility, kailangan mong tanungin or determine ano ba yung blood type ng nanay. Question, sa RH incompatibility ba, sino ang nagkakaroon ng problema? Itong current pregnancy or yung next na pregnancy? Current or next? Current or next? Yung next na pregnancy. Ngayong pregnancy na ito, nagde-develop yung antibodies na aatake sa susunod na pregnancy kapag nagkaroon ng accidental puncture ng umbilical cord. Now, para maiwasan ng RH incompatibility, anong ibibigay mo para ma-prevent? What are you going to administer? Rogam. Kailan binibigay si Rogam? At what weeks of pregnancy? Usually, ibinibigay ito at 28 weeks of pregnancy. Okay tayo dyan, ha? Wala tayong problema? Ayos ba? Okay, do you have any questions so far? So far, so good? Okay, sige. Dahil wala tayong problema, yung patterns of inheritance, sa susunod na session na lang natin sa Saturday. Magkasama naman tayo ng Saturday at saka Sunday. OB2 at saka OB3. Okay? Any questions so far? So far, so good? Wala naman? Sige, kung wala kayong question, magandang gabi sa inyong lahat. Magandang umaga, magandang hapon. Nasaang man parte kayo ng mundo. Bye! Take care! See you next week! Thank you! Thank you so much, everyone! Bye! I appreciate y'all! Bye! Thank you, thank you! Ingat! Good night! Thank you so much! Bye! Thank you! Bye, Lawrence! Bye, JV! Thank you!